introductory remarks for us. So Elizabeth?
Thanks, Jeff. I just wanted to welcome everybody today to our workshop on updating the indoor guidelines for indoor air quality guidelines for NO2. We're really pleased to have an excellent set of panelists, and thanks to everybody who's attending the workshop, including agencies, experts, community members, and the public. We're excited to start this information gathering process for updating the guidelines and to learn more about indoor NO2 exposures and ways we can help to reduce those exposures. In this workshop, we will hear presentations on the need for updating the guidelines. The last guidelines for indoor air pollution were published in our 2005 report to the legislature. And we'll also hear on how indoor guidelines have been developed by other agencies, perspectives from our partner agencies and their efforts, the latest research on the health effects of indoor pollutants and ways to reduce exposure, as well as perspectives and research by environmental justice focused organizations and how vulnerable communities are impacted by poor indoor air quality. So really excited. This is a great set of panelists and I hope to have a really great discussion. And again, thank you for attending. I'm going to turn it back over to Jeff Williams and Pat Wong, who are going to give a brief presentation.
Great, thank you, Elizabeth. So before we get started, here are a few housekeeping items that are going to help to keep our workshop running smoothly. So the chat is going to be for CARB to provide links and other information. If you'd like to submit a written question, please do so by clicking the QA icon at the bottom of your screen. You can type your questions in the panel on the right-hand side of the presentation window. If you want to ask a question live, you can use the raise hand feature by clicking on the reactions icon at the bottom of the screen. We'll have time for questions and answers at the end of each panel discussion. So please hold any live questions until the panel presentations are concluded, and we will unmute you when it is your turn. When called on, please identify yourself and your affiliation and let us know if you have a question or a comment. If you'd like to make a comment, we ask that you keep it under 2 minutes. You can also submit comments on the web page. If we do not get to your question during the QA period at the end of the panel session, you're welcome to submit it via email to iaqguidelines@arb.ca.gov. And if you have any technical difficulties, please email Victoria Villa, and she'll try to assist you. We're recording this meeting and we'll post the recording and the presentation slides on our website. And finally, we'll send out an email to the registered participants when these are posted. Now, here's a few of the CARB staff who are helping out with the IAQ workshop today. We have, of course, Elizabeth Sheely, our Chief of the Research Division, Bonnie Holmes-Jen, our Branch Chief of the Health and Exposure Assessment Branch, and then Pat Wong, who is the manager of our Building and Indoor Environment section. And you have myself, Zoe Zhang, and Victoria Villa, who are all in the Building and Indoor Environment section. So here's our agenda for today, and you can also find this agenda on our website. And Pat Wong and I are going to start out with a brief presentation of the background and objectives for this workshop. Then after our presentation, we're going to move into the panel portion of the workshop. We'll have 4 panels that are going to range from anywhere from about 30 to 45 minutes per panel. And then at the end of our panel discussion, we'll open the workshop to a final round of questions and comments, and then have some brief closing remarks. A key objective of today's workshop is to gather information. We're going to hear about recent health research on NO2 and how US and Canadian agencies have approached the process of guideline development and some of the challenges they have faced. We'll also hear about IAQ research that is being done by other government agencies and in the medical profession, and how other organizations are using that research and ways that updated guidelines might be used. Also, our community partners will tell us about their unique health concerns and the challenges they face in trying to improve indoor air quality. We know from time activity studies that people spend about 90% of their time indoors. And there's a significant body of research showing that indoor levels of NO2 can commonly exceed levels that would be considered unhealthy outdoors. Professor and Nobel recipient Kirk Smith highlighted the exposure implications of indoor pollutants when he stated that pollutants released indoors are about 1,000 times more likely to reach someone's lung than if released outdoors. Also, we know that NO2 emissions generated indoors affect both indoor and outdoor air quality. Of the numerous pollutants found indoors, the focus of today's workshop will be nitrogen dioxide. NO2 is an indoor pollutant that is commonly produced by combustion appliances in the indoor environment. Exposure to NO2 has been demonstrated to have numerous health effects, such as increased incidences of asthma. In fact, a recent study by Grunwald estimated that nearly 13% of childhood asthma in the US could be attributed to gas stoves. NO2 is also associated with increased respiratory disease and decreased lung function. These effects are most pronounced in vulnerable groups, such as young children, the elderly, and residents of low SES communities. So now I'll turn it over to Pat, who will present the next few slides.
Okay, thanks, Jeff. Here's a brief timeline showing the history of the development of the indoor guidelines by CARB and other agencies. CARB most recently published indoor air quality guidelines, which were part of the 2005 legislative report on indoor air quality. And at that time, a 1-hour NO2 guideline was set at 250 parts per billion. Since then, CARB and US EPA lowered their ambient air quality standards in 2007 and 2010, respectively. Afterwards, the WHO and Health Canada updated their IAQ guidelines with the major updates in 2015 for Health Canada and WHO a couple years ago. Which brings us to our efforts today. We have speakers from both Health Canada and the WHO who will discuss the guideline process, and we hope to build upon previous work done by these two respected organizations. This table lists the current guidelines and standards from CARB, along with those from Health Canada and WHO. You can see that CARB's 1-hour and 24-hour indoor guideline values are significantly higher than the current Health Canada and WHO indoor guideline levels. We've been getting the question on why now is the time to update our NO2 guidelines, and there are a number of reasons. First, the guidelines are fairly outdated, especially given the fact that CARB last published the indoor guidelines in the 2005 report to the legislature titled Indoor Air Pollution in California. Since then, as mentioned previously, agencies such as Health Canada and the WHO have adopted more health protective indoor guidelines for NO2 and other pollutants based on more current studies. There also have been recent studies which highlight possible hazardous levels of NO2 in residences. This highlights the need for updated guidelines to determine what levels need to be achieved to protect residents, especially those in vulnerable communities who are at greater risk of exposure to high levels of indoor NO2. It is our hope that updated indoor guidelines will also provide guidance for other agencies with indoor air quality policies and motivate research to develop technologies and approaches to achieve greater reduction in indoor pollutants. New guidelines will also help the public better understand what level indoor NO2 is protective of health. And now I'll hand it back to Jeff to wrap up the presentation.
Great, thank you, Pat. So this is our current work plan for developing the new indoor guidelines. We started with internal briefings last year, and we also met with international and state agencies, as well as community-based organizations to invite speakers in preparation for today's workshop. The plan is to work on a draft guidelines document this summer and then hold another workshop in the spring of 2024 to get comments on the draft document. We hope to have a completed draft document in late 2024. In closing, here's a quick snapshot of the 4 panels we have for today and the topics they will cover. So we'll start with our international agencies, and I'll talk about guideline development, scientific foundations. Then we'll move into state agency perspectives, which is about recent research on indoor air quality and state programs affecting IAQ. Then the third panel will be nonprofits and community groups, and they'll talk about community perspectives on IAQ and guideline development. And then finally, our academic experts who will talk about recent research findings on NO2 and IAQ and children's health and NO2. So thank you again. Appreciate everyone attending today. And here's our email address and the link to our webpage one more time in case you missed it earlier. And we'll have time for questions and answers at the end of our first panel discussion. So now I'm going to hand it back to Pat, who's going to introduce our first panel, and he'll also be our panel moderator. So Pat, over to you.
Hi, thank you, Jeff. And yes, my name is Pat Wong, and I manage the Building and Indoor Environment section. It's my pleasure today to moderate the first panel on guideline development and scientific foundation. Our first speakers from Health Canada are Dr. Jocelyn Moore. She is a senior scientific evaluator in the Water and Air Quality Bureau at Health Canada. She conducts human health risk assessments and supports risk management activities for indoor air contaminants in residential settings, as well as developing outreach materials for Indigenous communities. Stephanie Willie is also a senior scientific evaluator in the Water and Air Quality Bureau at Health Canada. In addition to conducting human health assessments for indoor air contaminants, she has developed a prioritization process for these contaminants and investigates the indoor air issues in public spaces. After the Health Canada's presentation, you'll hear from Tom Lubin, and I'll introduce him before his presentation. So Jocelyn and Stephanie, please start.
Okay, thanks, Pat. And I'm going to stop sharing my screen now. And Stephanie or Jocelyn, you can go ahead and share yours.
Nice.
Okay, can everybody see the first slide there?
Looks great.
Yes.
You're not in presentation. There you go. That looks great.
Okay. Thanks. So as Pat mentioned, I'm Stephanie Ville, and along with my colleague Jocelyn Moore, we are representing the Indoor Air Contaminants Assessment section in the Water and Air Quality Bureau at Health Canada. And we're going to talk today about the development and use of Health Canada indoor air quality exposure limits. So just a quick overview of our presentation. We're going to introduce our program at Health Canada, explain our process for prioritizing contaminants for risk assessment. We'll discuss the development of residential indoor air quality guidelines and indoor air reference levels. And finally, we will show some ways our risk assessment products are used, including in standards development. So the indoor air program at Health Canada has a mandate. You can read it here. It's basically says we're promoting and protecting the health of Canadians by evaluating, researching, and communicating the health effects of indoor air contaminants and contributing to developing solutions for improving indoor air quality. So really what we do is we develop and promote best practices to improve indoor air quality by assessing, researching, and communicating the health impact of indoor air contaminants and strategies to reduce exposure. And we do this by conducting risk assessments to understand adverse health impacts of exposure to indoor air contaminants, leading health research to understand exposure and health impacts in the Canadian context, and by communicating science-based guidance and strategies to reduce exposure in the home and other indoor spaces. So since there are many contaminants in indoor air, we need to select which ones to focus on. So we start with a list of indoor air contaminants for consideration that we develop based on many factors, including research, literature, and input from our partners and stakeholders. We then prioritize contaminants based on health risk, and we incorporate recent inhalation health effects data, as well as Canadian indoor air exposure data. We give greater priority to contaminants with new information suggesting potential health concern. Then we consider other criteria when determining a course of action for each priority contaminant. And this includes things like data gaps, government priorities, stakeholder and partner needs. And possible outcomes of this prioritization process include development of residential indoor air quality guidelines or indoor air reference levels, which we're going to talk about next. So residential indoor air quality guidelines are voluntary objectives under the Canadian Environmental Protection Act. They contain calculated health-based exposure limits using currently available scientific data. They take into account populations that are more highly exposed and or biologically susceptible. They are used to characterize risk as well as provide a scientific basis for risk mitigation recommendations to reduce exposure and protect health. So our risk assessment process is focused on the effects of exposures in indoor environments. We start with a literature review to identify key health effects for each priority contaminant. And we conduct a dose response assessment and determine a reference concentration for the most sensitive health effect that can be attributed to the contaminant in an indoor environment. Reference concentrations are usually developed for both short and long-term exposures and represent concentrations below which health effects are less likely. And for contaminants with a key effect of cancer, a risk-specific concentration is determined, which usually corresponds to an excess cancer risk of 1 in 100,000. Indoor residential concentration and sources of contaminants identified in research conducted by Health Canada and our partners are key to assessing exposure in the Canadian context. During the risk characterization step, the reference concentration is considered in the context of real-life exposure to gauge feasibility and develop guideline values, which are also called exposure limits. And this is a list of guidelines that we have for key indoor contaminants, which includes formaldehyde, nitrogen dioxide, ozone, and others. Our most recent ones that we've added are acrolein, carbon dioxide, and xylenes. And any contaminants for which we couldn't determine an exposure limit from the available scientific evidence have guideline documents focusing on actions to reduce exposure. And now I'm going to turn it over to my colleague, Jocelyn Moore, who's going to finish up the presentation.
Hi. So our secondary risk assessment product are indoor air reference levels. These are developed as a supplement to our guideline values. These are developed for indoor air contaminants that either have insufficient data available for a full risk assessment or are identified in our prioritization process, but at a lower level of priority. IRLs are selected by screening inhalation reference concentrations and hazard assessments from other jurisdictions and do not include an exposure assessment. They have the advantage of being quicker to develop and can be applied to some of our risk mitigation activities. However, they are not fully assessed by Health Canada and are only based on chronic endpoints, unlike our guidelines that generally address short-term health effects as well. We currently have IRLs developed for 23 substances. These include carbon tetrachloride, cyclohexane, ethylbenzene, methyl ethyl ketone, and styrene, and more. And they address non-cancer and cancer health endpoints. Since the first IRL development, 3 of the substances have been updated as residential indoor air quality guidelines. These are acetaldehyde, acrolein, and xylenes. Our risk assessment products are used to develop science-based guidance and risk mitigation advice to reduce exposure to indoor air contaminants for people who live in Canada. These are communicated to professional audiences in guidance documents and to the general public in shorter info sheets, infographics, and visual fact sheets, as well as in retail campaigns. Risk assessment findings are incorporated into guidance for public spaces and other indoor air health issues, such as monitoring and response, and key concentrations that trigger action, such as when to enact specific ventilation strategies in public spaces, such as ice arenas. Our guideline values are used as well as risk assessment benchmarks for federal, provincial, and territorial activities. Risk assessments also inform research priorities by identifying data gaps, understudied populations, and ideas for testing of risk mitigation strategies. And finally, our guideline values and evidence-based risk mitigation strategies are used in building codes and product standards. So our guidelines have been used in the development of national standards in Canada that are related to indoor air quality and involve priority contaminants. The most recent example of this was in the development of the CSA formaldehyde emission standards from composite wood products, which of course was based on the CARB and later EPA regulations. A representative of the indoor air program was included in the technical committee, and the health-based long-term guideline value was the basis to calculate the maximum allowable chamber concentration for the products. The potential benefit of the standard was demonstrated by air program research, including our pilot new home study and building product emission testing. The standard then went on to be the foundation of our formaldehyde emissions from composite wood products regulations, which were enacted in 2021. So the indoor air program was also involved in the development of the CSA standard for residential carbon monoxide alarming devices. We advocated for the inclusion of a low-level carbon monoxide display with action recommendations that align to our long-term guideline value of 10 parts per million. We continue to promote the importance of the proper use of carbon monoxide alarms that meet our CSA standard in our communication products, like our infographics and a Detect to Protect retail campaign. We also consulted in the development of the CSA electrostatic air cleaners standard and provided scientific expertise to the process. We recommended the inclusion of our long-term guideline value for ozone to reduce exposure. However, at the time of the guideline, it was not technically feasible due to limitations in detection levels. However, with increased interest in the use of air cleaners due to COVID, we developed a new graphic to advise the public on how to select an air cleaner that meets the standard and is appropriate for homes and other indoor spaces. So for more information about our residential indoor air quality guidelines, you can use the link included here. You can also subscribe to the Health Canada Air mailing list to be updated on future publications, and contact Stephanie and I directly if you have further questions. And I'd just like to thank and acknowledge the staff and management at the Water and Air Quality Bureau and the Safe Environment Directorate of Health Canada. So if anybody has any questions or
I guess we're going to hold questions till after both presentations, but yeah, thank you, Stephanie and Jocelyn, for the presentation. Learned a lot from that. We're going to move on to the second presentation with Tom Lubin. So Dr. Tom Lubin is a senior epidemiologist at the US EPA Center for Public Health and Environmental Assessment. Recently, he has worked to gain an understanding of the association between exposure to environmental and climate-related exposures and various adverse birth outcomes and climate-related exposures and various adverse birth outcomes such as preterm birth and infant mortality. From 2016 and 2021, Tom worked as a temporary advisor for the WHO and was a member of the guideline development group providing advice to the WHO on the 2021 Global Air Quality Guidelines. So I see Tom's presentation up. So Tom, thank you.
Great, thanks, Pat. And good morning or good afternoon to everyone. I'm happy to be here today. And I'm in a bit of a unique position here. I do work for the Environmental Protection Agency. And in that role, most of my work has been looking at ambient air quality. I spent the first 12 years of my time here at the EPA working on the National Ambient Air Quality Standards and specifically creating the integrated science assessments, which are the scientific documents that support those ambient air quality standards. But as Pat mentioned, I had this fantastic opportunity between 2016 and 2021 to work as a temporary advisor to WHO as part of the Air Quality Guideline Development Group. And so I'm going to be talking today about that experience that led to the 2021 Air Quality Guidelines. So the air quality guidelines are based on scientific evidence, and they are guidelines that are made in order to protect public health worldwide. And so they provide recommendations on levels as well as interim targets for a number of criteria air pollutants, including particulate matter, ozone, nitrogen dioxide, sulfur dioxide, and CO. And the 2021 guidelines also included some good practice statements for things like ultrafine particles and dust. The guidelines are used as an evidence-informed reference to help decision makers, but they are not standards themselves. They are not legally binding themselves, but could be used by others to create legally binding standards. And they're an instrument that is hoped to reduce air pollution and therefore protect public health. And hopefully Pat and Jeff won't get mad. I added in a slide from what I sent them earlier, but I thought it would be good for this group because I kind of wanted to give the bottom line up front, right, about indoor NO2 air quality guidelines. And so the 2021 air quality guidelines are applicable to both outdoor and indoor environments, but they don't cover occupational settings. But I want to be clear that when we were reviewing the literature to inform the 2021 guidelines, that studies that evaluated indoor exposure only were not included and did not inform the decisions that we made. And that's a little bit different than the previous version of the air quality guidelines, which were from 2005. In the 2005 air quality guidelines, specifically for long-term exposure to NO2, there was evidence on morbidity observed in children exposed indoor to NO2 from gas cooking. So in 2005, those kind of indoor-only exposure studies were incorporated into the guideline consideration. In 2021, they were not. And then the short averaging time guidelines that were included both in the 2005 global update as well as WHO's 2010 indoor air quality guidelines were not reevaluated in 2021, but they remain valid. And so you can see a table that is from the 2021 air quality guidelines that includes some of these shorter term, shorter averaging times that were not reevaluated. So the 1 hour averaging time for NO2 has an air quality guideline of 200 microgram per meter cubed. And I just wanted to point out quickly that Pat presented in his early slides a value of 106. That's in parts per million. And so just the difference in the units here, going from microgram per meter cubed to parts per million, we go from 200 micrograms per meter cubed to about 106 parts per million. So that's why those numbers aren't exactly the same. And then down here in the blue box, I'm putting the conclusion, the bottom line right up front. In the 2021 air quality guidelines, there is an annual average or a long-term guideline for NO2 of 10 microgram per meter cubed, a short-term daily average, 24-hour average of 25 microgram per meter cubed, and then the 1 hour is still relevant, still valid from the previous indoor air quality guidelines at 200 micrograms per meter cubed. So I'm gonna go through some of these slides, and I've tried to whittle it down as best I could, and I'm really gonna focus on two parts: how the guidelines were developed and then how the guidelines can be used. So the guideline development involved three main steps. There was a systematic review process. Then the evidence was graded to evaluate its ability to draw inferences from in creating these guidelines. And then the guidelines themselves were developed. And these three main steps were taken on by several different groups. There was a systematic review team that was an external review group to WHO who acted as temporary advisors. And then there was also the guideline development group, which is the group that I was a part of. And both of those groups were overseen by a WHO steering committee. So the scope of the air quality guidelines, this was a 5-year process, and it started with the selection of the pollutants that we were interested in. And then we looked at different pollutant morbidity or mortality outcome pairs to see where the evidence was most certain. The guideline development group considered criteria and conclusions from Health Canada, from the US EPA, from IARC, from other places in the EU, and eventually decided that we would develop air quality guidelines for particulate matter, specifically PM10 and PM2.5, ozone, nitrogen dioxide, sulfur dioxide, and carbon monoxide, with additional good practice statements for black carbon or elemental carbon, ultrafine particles, and sand and dust storms. And so the first part I'm going to talk about briefly is the systematic review process. So WHO commissioned a number of systematic reviews, and these are outlined here on the slide. Each of the 6 different systematic reviews was published in a special issue of Environment International, and I have the link to that here in the slide. And so really it was, these systematic reviews did exhaustive literature searches and compiled all of the available epidemiologic evidence for these pollutants and the health outcomes that are listed, and systematically reviewed the evidence as well as did a meta-analysis to come up with a pooled effect estimate. The next step was grading the evidence. This was also completed by the systematic review team. And WHO used something called GRADE, which is a framework for assessing the quality of evidence. And this was designed to assess the certainty of evidence from the systematic reviews that WHO had commissioned. The systematic review team received guidance on how to apply GRADE to these observational epidemiologic studies. And then the ratings were used in the process of deriving the air quality guidelines. And then the guideline development group, which I was a part of, pilot tested discussed these, and they were kind of iteratively developed as we went through the process. So the last step, and where I'll spend the most of my time, is how the recommendations were developed. And there's an 8-step procedure that we use to move from the evidence presented in the systematic reviews to the air quality guidelines. And the derivation of the guideline levels was a little bit different for long-term or annual average guidelines compared to the short-term or the 24-hour daily guidelines. But we started with the effect estimates and the concentration response function from the systematic reviews. We wanted to find and identify the lowest level of exposure measured, as well as the minimal relevant increase in a health outcome. And then using those, we had a starting point for the guideline, the air quality guideline determination. For some pollutants, we looked at more than one health outcome. So it might have been that we looked at asthma hospital admissions, as well as mortality, or cardiovascular hospital admissions, as well as mortality. So we wanted to kind of compare and, smooth over the air quality guidelines across the two different health outcomes. We considered the certainty of the evidence. We went back and looked to see if there was any new evidence since the systematic reviews had been completed. And then we made sure that the evidence supported a causal relationship rather than just a simple correlation. And then there were 3 different scenarios for the short-term air quality guidelines, which are what I'm going to focus on here. So scenario 1 would be if there's a short-term air quality guideline level for a pollutant for which a long-term guideline was already developed. So we started with the long-term guidelines. And so when we went to start considering the short-term ones, we looked to see first, had we set a guideline for long-term exposure? And for NO2, we had. So scenario 2 is for that case. So development of a short-term air quality guideline for which a long-term guideline level was developed for a different outcome. So for NO2, we looked at both mortality as well as hospital admissions and emergency department visits for long-term exposure to NO2. So there were 2 different health outcomes for which a long-term guideline had been developed. And then scenario 3 would be if developing a short-term air quality guideline if there was no long-term air quality guideline. So here's kind of the scenario for NO2. Again, it was scenario 1. We had all-cause mortality plus morbidity, and the morbidity in this case was for daily hospital admissions for asthma. So what we wanted to do is find the ratio of the 99th percentile of all of the distributions of 24-hour means to the mean of the distribution. And so the mean of the distribution was very similar to the long-term air quality guideline of 10 micrograms per meter cubed. And then the ratio that we got for the 99th percentile from the MCC database is about 2.5. So we multiplied 2.5 times 10 to get a short-term air quality guideline level of 25 micrograms per meter cubed. So what does this mean? So this means that we would expect that excess mortality and morbidity at a day at the short-term level, so a day of 25 micrograms per meter cubed compared to the long-term level, so compared to 10 micrograms per meter cubed, would result in about a 1.1% increase in mortality or a 2.1% increase in morbidity. However, if we assume compliance with the long-term air quality guideline level, days with concentrations close to 25 micrograms per meter cubed will be rare. Most days will have much lower levels, with close to half of those days having concentrations below or far below the annual air quality level. And so because of that, we think the health burden related to a few days with higher concentrations will correspond to a very small fraction of total air pollution related burden. So in this case for NO2, we are assuming that the long-term air quality guideline level is going to be more of the controlling guideline than the short-term. Here are just the long-term levels for each of the pollutants that we looked at. So we have a long-term level for PM2.5 of 5 micrograms per meter cubed. For PM10, it was 15 micrograms per meter cubed. Ozone, which is a seasonal average, not necessarily an annual average, was 60 micrograms per meter cubed. And then NO2, which we've talked about, was 10. And then the short-term air quality guideline levels, again, for fine particulate matter, PM2.5, 15 micrograms per meter cubed. For PM10, 45 micrograms per meter cubed. Ozone, and that's the 8-hour period. The highest 8-hour period in a 24-hour day is 100 micrograms per meter cubed. NO2, which we've been talking about, is 25. Sulfur dioxide is 40, and carbon monoxide was 4. So what do the air quality guidelines provide? And here I've kind of outlined and read the NO2 one, since that's a lot of what we're talking about. So the air quality guidelines provide levels for both long and short-term exposure related to critical health outcomes. They also provide these interim targets to guide reduction efforts. And so these interim targets are created for areas around the world where the ambient concentrations are already way above what the air quality guideline level might be. So we tried to come up with these interim levels so that we could provide kind of these other kind of goals to reach before they kind of get to the finish line that might seem more reasonable, and they can kind of develop a tiered approach that has different time points for meeting each of the different interim targets. And then the good practice statements were made for different types of particulate matter for which the evidence was not quite sufficient to derive a quantitative guideline at this point in time. So how could the updated air quality guidelines be used? We hope that they will be an evidence-informed tool used by decision makers, policy makers, legislatures, to reduce levels of air pollutants to a level that will prevent health burden. We hope that they can also be used to stimulate research and identify data gaps where future research agendas could address how public health can be better protected from air pollution, and then finally to improve air quality in an effort to mitigate climate change. There's a lot of interplay between atmospheric chemistry of these air pollutants in the environment and climate factors. And so hopefully by reducing air pollution, we will in turn help to mitigate climate change. And that is it for me. I went through that fairly quickly, but hope we will have some time for conversation and questions now.
Okay, thank you, Tom, and thank you to all the speakers in our first panel. I guess we do, well, first of all, do we have any questions from the audience? I did not see any hands raised. Okay, I guess a question did come in for Health Canada from Brady Seals from Rocky Mountain Institute. The question is there a planned date to update the guidelines for NO2?
That's an easy one, no.
No, okay. I guess the next question is for both groups, and I guess Tom could start. Approximately how much time is spent developing each updated guideline, and what was the biggest challenge and time-consuming part of the process?
Yeah, that's a great question. So I think I mentioned we took about 5 years developing the air quality guidelines that were released in 2021. The initial meeting happened in 2015 and then 2016. And then the biggest, I guess, challenge, I think, or the most time-consuming part, it was very time-consuming to both commission and then complete the systematic reviews and have those published in the peer-reviewed literature. And then this was from my understanding, the first time that WHO was using this grade system for evaluating study quality and the certainty of the evidence base. And so there was a little bit of a learning curve there that we all had to kind of come up to speed on. And then I guess finally, I'll say, COVID interrupted the process a little bit. We were having in-person meetings on an annual basis, and that stopped in 2020. We moved to online and virtual. meetings, and we're able to finish the guidelines that way.
Yeah, thanks, Tom.
And Pat, I see we have another question in
Oh,
the Q&A from
okay.
Mark Mendel.
Okay, I think maybe we'll wait for Health Canada to answer that last question first, and then we'll move to Mark Mendel.
Apologies. Sorry about that.
No problem.
Hi, so for us, the development of our guidelines is usually about a 2 to 3 year process. The first 1 to 2 years is the data gathering and actually writing of the draft. And then we have about a year-long approval and review process with internal and external review. And in terms of challenges for us, because we're a government organization, a lot of our challenge comes from aligning the needs of different departments, because indoor air, the values that we derive impacts outdoor air as well, outdoor air values and their approach, and it also impacts other groups such as consumer products, tobacco control, and other interested parties. And I'd say another challenge would be incorporating the feasibility aspect. That can be quite difficult.
Okay, thank you. We did just have a question come in from Mark Mendel. Looks like it's for WHO. What is the reasoning for WHO to exclude studies of only indoor NO2?
Yeah, so I think that, in 2010, WHO did a separate indoor air quality guideline. I think they were trying to conserve resources, and the focus of this really was on ambient air quality, but then they made this decision that they thought that the guidelines that were developed here could also be applied to indoor environments. From a technical standpoint, I think it would be difficult to combine evidence bases where you are looking at studies that are exclusively ambient concentrations and then other studies that are exclusively indoor concentrations, because you have different pollutant mixtures, different, the co-pollutants that occur in those environments are different. So, I'm hypothesizing here. I don't know what WHO's actual justification was, but I can see how that could be different. And I think when you're doing a systematic review, I think having a very specific research question is very important to do a systematic review. And so I think limiting it to just the ambient exposures was important for those systematic reviews.
Okay, thank you, Tom. And I guess we have a question for both groups coming from Bonnie Holmes Jen from CARB. Could you talk about the differences between the two approaches with respect to NO2 and the implications for the final results?
So I'll jump in first. As someone who had this opportunity to work with WHO, but who's also worked on regulatory standards for EPA. When we do regulatory standards at EPA, we are not looking to do a zero risk-based standard, right? We are looking to protect public health with a margin of safety that is in the judgment of the EPA administrator. At WHO, they were looking to find the lowest level to be the most public health protective as possible. So getting as close to a zero risk guideline level as possible. So that's one difference there is, whether you're doing kind of the, for a guideline, we want to be as public health protective as possible. For a standard, we have to kind of balance other things, and the goal is not zero risk, but appropriate public health protection with an adequate margin of safety.
Okay, thanks, Tom.
The question was something about the difference between two approaches, and I'm not sure I understand which.
So, yeah, I'm sorry. Maybe I could just, that was
Okay.
a really helpful answer. I appreciate that, Tom. I like that answer.
Okay.
I also was interested in the differences between, the two presentations, the WHO approach and the Health Canada. And part of that was answered, in just talking about the different type of evidence that was considered, as you just referred to. But yeah, just if you could maybe comment a little more on the differences between the two approaches presented today and implications for the final result. Thank you.
Sure. Yeah, I guess, obviously, as Tom mentioned, the WHO guidelines were not specific for indoor air, whereas our group develops exposure limits that are specific for indoor air. So we are focused more on those types of studies. However, there's a lot of similarities too, in the sense that we take a scientific health-based approach. We develop a reference concentration, but we also have to balance that with things like feasibility and policy implications. I'm not sure if that answers your question, or maybe Jocelyn has some more to add here.
I think that, yeah, I think that you largely got the answer. I'm trying to think of what we could add to it. When we, I guess, would be to just go a little further on the feasibility, because we do consider what the levels are in Canadian homes and how achievable the health-based value would be in that context, and with the information that we have at the time on risk mitigation strategies.
And then I'll just add on, Bonnie, that, you know, for the WHO guidelines, we started by surveying different, the work of the Health Canada, the work of EPA, the work of IARC, to see where causality had been established, or close to causality had been established, between these different air pollutants and health outcomes. And so we started with the health outcome pollutant pairs where there was the most certainty, right? And then we added on to that by looking and doing a survey of just epidemiologic evidence for those pairs. Whereas I think in a typical EPA, review, we would look at epidemiologic evidence, toxicological evidence, controlled human exposure evidence, and we would look for all health outcomes, not the ones that we just have the best evidence for, right? We would kind of survey all health evidence. So I think it's a little broader in that respect, whereas WHO kind of started with the pollutants and the health outcomes where evidence is already fairly certain or fairly well studied.
Thank you.
Okay, thank you. I noticed Brett Singer has his hand up. So Brett, why don't you unmute yourself and ask your question?
Thanks. First, it's just a question of clarification. And this is about the World Health Organization standard of, you said to develop a 24-hour standard, you looked at, if I understood correctly, the ratios of 24-hour concentrations to long-term average concentrations, took the 99th percentile of that and set it around that. So you're looking at the kind of the edge cases of, very high 24-hour in the same place, there's long-term. You also said earlier that, that's correct, you're shaking your head, that's great. So, okay, thank you. That you didn't look at indoor. So sort of two questions. One is, when you looked at those ratios of 24-hour to long-term average, was that only with outdoor data, only with indoor data, or some combination? So just a simple clarification question.
I believe it was only outdoor.
Okay.
I would have to go back and confirm, but I'm fairly certain it was just outdoor.
And then the follow-up is picking up the question that Mark Mendel asked about the reasoning of excluding the indoor studies, right, where most exposure happens, including to the outdoor, right? So we know that, for example, if there's no indoor sources, exposures indoors to those are lower than whatever you're measuring outdoors. But there are indoor sources that can add appreciably, right? So given that most exposure is happening indoors, and there's a body of literature on indoor exposures and health impacts, what was the rationale for not focusing? If you were to pick, it would seem like you'd almost go the opposite way and pick on, the actual exposures rather than this, what we know to be a poor surrogate for exposure. So can you say a little bit more about that?
Yeah, and I think that's a great question. And to be honest, I don't know WHO's justification. I can hypothesize a few things. I think these, were meant to be ambient air quality guidelines. And I think they then decided to include upfront in the air quality guidelines that they apply both to indoor and outdoor environments. I think also the fact that these are global air quality guidelines makes it difficult to talk about indoor, because indoor exposures are very different across the globe in, high and middle income countries compared to lower income countries. The types of fuel that are used indoors, the sources of indoor air pollutants across the globe are very different. So I think that would have been an added complexity to include indoor air for these global air quality guidelines by WHO. But again, these are my own conjectures, and I don't know WHO's justification.
Yeah, thank you very much.
Okay, and yeah, it looks like we're at time for the second panel. I'd like to thank Tom, Jocelyn, and Stephanie again. We did have some additional questions from Brady Seals and Mark Mendel, which we could, I guess, table now till the Q&A period at the end of all the panels. So thank you so much for your presentations today. And I guess I will pass it on to Zoe.
Thank you, Pat, and thank you everyone for joining us today. My name is Zoe Jiang. I will be the moderator for the second panel. For the second panel, we're very happy to have three speakers from California state agencies. They are Dr. Mei Wu from OEHA, Dr. Wenhao Chen from CDPH, and Dr. Melinda Dinger from CDC. So this panel's focus will be the indoor air quality research funded by our state agency and also state programs that are affecting indoor air quality. So our first speaker, Dr. Mei Wu, is a research scientist in the Air and Climate Epidemiology section at the Office of Environmental Health Hazard Assessment, or OEHA, of the Cal EPA. Dr. Wu has been involved in many studies on human exposure to outdoor and indoor air pollutants. Her current work focuses on health effects associated with criteria air pollutants and climate-related factors, such as heat and wildfire smoke. So our second speaker will be Dr. Wenhao Chen. Dr. Wenhao Chen is a research scientist with Environmental Health Labs branch at the California Department of Public Health. Dr. Chen has worked many years in indoor air quality field and has technical expertise in controlling emissions from indoor materials and products, building ventilation, and air cleaning technologies. Our third speaker will be Dr. Melinda Thing. Dr. Melinda Thing is a research manager in the California Energy Commission's energy-related environmental research team, which is part of Research and Development Division. Melinda manages environmental team's research portfolio at the nexus of air quality, human health, and California's clean energy transition. Before joining CEC, Melinda earned his PhD degree in environmental engineering from the University of Washington, Seattle, where his research was focused on modeling and quantifying air quality, human health, and climate impacts from different energy systems, including electricity generation and transportation. With that, please join me to welcome the first speaker, Dr. Wu. Dr. Wu, you may start your presentation.
Thank you, Zoe, for the introduction. Let me see.
Can you share your screen?
Yes. Is it showing correctly?
Yes, great. Thank you.
Okay. Good morning, everyone. Great presentation discussion from the first panel. That's exactly I intend to cover, actually, the discussion part. My name is Xiangmei Wu. I'm from Office of Environmental Health Hazard Assessment, OEHA. OEHA is a research agency under Cal EPA. We conduct research to support policy decisions and actions from all California EPA board and departments. Thank you for having me today. My talk will be focusing on nitrogen dioxide exposures and health effect studies in California. My talk will cover three components: health studies about NO2 in California, indoor NO2 levels in California, and the standard development approaches. This is a diagram of NO2 respiratory effects cited from US EPA 2016 Integrated Science Assessment. I want to spend too much time on biological pathway for NO2 effect. Just want to mention that by the time of the 2016 review, the only confirmed causal relationship was between short-term NO2 exposure and the respiratory effect, shown as the solid lines and the black boxes. The relationship between long-term NO2 exposure and the respiratory effect was likely causal, and the relationship with cardiovascular effect, diabetes, cancer, and total mortality were suggestive of causal. The recent WHO review found consistent positive association between total mortality and ambient NO2 exposure. So this relationship may be updated in the upcoming US EPA review. Now let's take a look at California specific studies. Here I focus more on recent publications since 2015, because studies earlier than that have been considered by existing standard review. Most of these studies use the outdoor concentration as exposure, and a few measured personal exposure levels. Research on health effects of indoor NO2 exposure is scarce, and most of the time, health effects are non-detectable at normal indoor NO2 exposure level. In this chart, I align health effects to the average or median concentrations reported in these studies. The concentration were average daily, monthly, or annually concentration, representing average long-term NO2 exposure. As you can see, a bunch of the studies report the respiratory effect, including lung function reduction, wheeze, and asthma onset, especially among children. Beyond that, other health effects were also observed in California, like effect related to pregnancy and childbirth, cognitive function impairment, mental health related injuries, cardiovascular effect. However, given the limited evidence, these outcomes haven't been confirmed. Current ambient air quality, current California ambient air quality standard, long-term standard for NO2 is 30 ppb. As you can see, most of these studies observed health effects with mean or median concentration level under 30 ppb. Some of these health effects were observed with average exposure level between 10 to 15 ppb. Another thing I want to mention here is that though we only see 2 studies about neurological outcomes in California, there have been overwhelming literature reporting associations between NO2 exposure and the neurodevelopmental and the cognitive functions from European countries and many other countries. The outcomes included reduced reaction time, decreased memory function, delayed psychomotor development among children, decline in overall cognitive function among adults. But given the inconsistency in results, the certainty of the evidence is low. There are also studies linking NO2 exposure and breast cancer and shortened telomere life outcomes, which predicts accelerated aging and a reduced lifespan. However, such outcomes have not been reported in California population specifically. Due to the difference in indoor sources and the ventilation related to climate and the building code, indoor NO2 concentrations vary between countries and regions. With the health effects in mind, let's look at the indoor NO2 levels in California. There are not many studies examining indoor NO2 concentrations. I summarized the recent studies in this figure and listed the report the mean or median concentrations. The studies are considered ordered by publication year because outdoor NO2 concentration, which is a major source of indoor NO2 exposure, decreased over the years. Thanks to our air quality control effort. The indoor and the outdoor concentration are shown in different colors, blue for indoor and orange for outdoor. The concentration shown here are average 24-hour or 1 week concentration, representing average exposure level. So they are compared to long-term standard. While short-term standard of 1 hour standard refer to peak hour or exposure level during cooking. The takeaway message from this overview is the average indoor NO2 concentration range between 5 to 35 ppb. Indoor NO2 levels are usually higher than outdoor concentration, apartment higher than single family house, kitchen higher than the whole house, winter higher than summer. Cooking with gas appliance cause higher exposure, but homes with electronic cooking appliance had lower exposure levels. If we align the existing NO2 standard and guideline level in this chart, outdoor levels met current California ambient air quality standard in general. But the majority of observations were above Health Canada indoor air quality guideline and WHO air quality guideline. The US National Ambient Air Quality Standard is not on this chart because it's way above this concentration shown here, which is 53 ppb. So these slides summarize the study monitoring or modeling indoor NO2 concentration during cooking hours, which are comparable to 1 hour short-term standard. The level shown here range up to hundreds of ppb. Exposure in the kitchen tends to be higher than the bedroom or the whole home during the cooking. When range hood was not used, exposure could be dramatically higher. Dr. Drew's research group in UCLA found out in their survey that less than 35% of California residents use the range hoods while cooking. When we add standard to this figure, you can tell how high the indoor NO2 concentration are during the cooking hours, way higher than the existing short-term NO2 standard. Okay, now it's time for us to look back how the existing standards were developed. The previous presenters have covered a lot. Here, I want to do a brief comparison here. I ordered this full standard relevant to North America and ordered by the time they were published or reviewed. Only the Health Canada indoor air quality guidelines for indoor exposure. The other three are for outdoor air quality. This standard was developed using slightly different approaches. California ambient air quality and national ambient air quality standards identify the range of ambient NO2 levels with the adverse health effects observed, and then select the levels below the range. Both standards look at the health effect of sensitive population, for example, asthmatic children, focusing on no health effects below the proposed standard, and no additional uncertain factors were adjusted. The Health Canada indoor air quality guideline started with key studies, using the concentration with respiratory symptoms among asthmatic children as point of departure. On top of that, applied uncertainty factor to account for using adverse effect level as point of departure. WHO air quality guideline was based on the review of epidemiological studies that examined the confirmed endpoint among the general public. And they used the fifth percentile concentration observed in the key epi studies for the largest extent of protection, and used the 99th percentile of daily concentration corresponding to the long-term air quality level as a daily suggests reference concentration. So no uncertain factor adjustment was made. Actually, it's not needed by using this approach. Another thing I want to note is, though Health Canada and WHO focus on indoor and outdoor NO2 exposure respectively, and use the different approaches, and you can see they reach the same reference concentration, like 10 microgram per cubic meter, and WHO also 10 micrograms per cubic meter. The different method, they reach the same, based on solely by science, they reach the same conclusion. Move to short-term 1 hour standard. Again, California ambient air quality standard and national ambient air quality standard selected a level below the range of concentration that adverse health effects were observed on sensitive populations. California ambient air quality standard added a little margin of safety for additional protection of asthmatic children. And national ambient air quality standard did not apply additional uncertain factor adjustment. Health Canada's indoor air quality guideline applied 10 times of uncertainty factor adjustment on top of the concentration with adverse effect, and threefold using adverse health effect as point of departure, threefold intraspecies variability, which is the difference between individuals to account for sensitive population. WHO returned 1 hour guideline developed in their earlier review.
And May, sorry to interrupt, just want to let you know 1 minute.
Okay. From policy perspective, all of these standard guidelines need to consider feasibility of achieving the standard. California ambient air quality standard and national ambient air quality standard are enforced by the federal or state EPA. So a no effect level without adjustment may be more practical at the balance to protect between the benefit of protecting public health and the cost of achieving the standard. While the Health Canada Indoor Air Quality Guideline and WHO Air Quality Guideline provide general guidance to stakeholders, pointing to the direction to move forward. So they also consider feasibility. The final Health Canada Indoor Air Quality Guideline, they made adjustment on top of the derived reference concentration, and WHO guideline set multiple interim targets above the recommended air quality guideline level. OEHA develops reference exposure levels for air toxics under the California Air Toxic Hotspot Program. We used both approach used by Health Canada and WHO depending on the evidence available. Our procedures start with literature review, then identify the point of departure, which could be lowest level of exposure with adverse outcome or highest level without adverse effect, or a benchmark level. Depending on the type of case study identified, if a point of departure is determined from the human exposure or chamber study, the ancillary factor adjustment will be applied as what Health Canada did. If case study is an epi study and the benchmark level was determined, then 50th percentile will be used as WHO did. To summarize my talk, so we observed how adverse health effect among Californians between the 10 to 30 ppb, and the indoor NO2 concentration in California range between 5 to 35 ppb, and the cooking hour could be like hundreds of ppb. For the new method development, we propose a path forward. WHO air quality guideline is considered the latest and best available science available. So further standard development could start from there and gather new information with a focus on California studies. And depending on the evidence available, the type of key studies identified will determine the point of departure and whether or which uncertainty factors are applicable, particularly for the protection of vulnerable population. And based on this evaluation and consideration, the final health reference level will be determined. Okay, that concludes my presentation. Thank you for your attention.
Thank you so much, Dr. Wu. And we will turn to the next speaker, Dr. Wenhao Chen. Would you please share your screen?
Yes, can you see my screen?
Yes. Can you put it on presenter mode?
Yeah.
Great.
Can you see it?
Yes. Good go.
Okay, great.
Thank you.
Yeah. Thank you for that introduction, Zoe, and to ARB for inviting me to speak at this workshop. So today I will talk about the work related to indoor air quality or IAQ guideline development at the California Department of Public Health, as well as some of our thoughts on the history and future needs related to developing IAQ guidelines, including NO2. So before I start, I have to first state that the findings and conclusions in these presentations are those of the presenter and do not necessarily represent the views of the California Department of Public Health or the California Health and Human Service agencies. I would like to start my presentation by looking back the history of air pollution regulations. So as we all know, the outdoor air pollution has been recognized as nuisance for centuries. And with the industrial growth across the country and the world, the air pollution problem became worsened and more widely publicized in 1940s and early 1950s due to several major smog events. Since then, people started to act. More research has been done to investigate the link between air pollution and health, And finally, in 1970, as a milestone, the US Congressman passed the Clean Air Act, which leads to the establishment and continuous improvement of nation's ambient air quality standards, including nitrogen dioxide as one of those key pollutants. On the contrast, the indoor air quality has not been seen harmful historically. Rather, most people thought that buildings provide protections from outdoor air pollution, and indoor air is always safer or healthier than outdoor air. The relatively high exposure and potential risks from toxic chemicals indoors started to only be explicitly recognized through the EPA's total exposure assessment methodology, or TEAM studies, back to early 1980s. And that study with the measurement data demonstrated that major sources of exposures to chemical pollutants were actually indoors. And since then, people started to pay more attention to the indoor environment, as well as the issue of indoor air quality on the health. And although the general ventilation standard for the indoor environment has already existed back to that time, I want to point out that those ventilation standards are established historically for the purpose of controlling odors from building occupants, all to a looser definition for providing comfort. And those ventilation standards are not based on the protecting occupants from health effects of specific pollutants. So all these increased attentions on the health risks from the indoor exposures have triggered more research on indoor air science, as well as a discussion about the possibility of IAQ standards or guidelines. So here I just listed a few reasons why having an IAQ guidelines or standards are so important from public health point of view. People spend on average approximately 90% of their time indoors. And as Dr. Brett Singer just have mentioned, because of this long time indoors, most of the exposure could actually occur indoors, even if the pollutants are initially formed outdoors and then enter indoor environment through building infiltration and ventilation. And the indoor air exposure levels could be even higher for those harmful chemicals with additional indoor sources, such as emissions from building materials, cleaning products, or combustion appliances. In addition, indoor air may also contain contaminants that are not originated from outdoor air, but pose significant health risk to occupants, such as the coronavirus that has just caused the COVID pandemic, as well as other airborne infectious agents. So putting all this together, we actually see that indoor air quality may or can be worse than outdoor. And as public health always focuses on the health promotion and disease prevention, we strongly support the development and application of indoor air quality guidelines or standards, including on NO2, to reduce the health risks to the occupants from indoor air exposure. So now I have talked about the needs for establishing IAQ guidelines or standards, but to the best of our knowledge, the majority of the existing IAQ indoor air regulations or enforceable exposure limits are actually for workplaces at much higher levels. So this is different from the IAQ standard we're talking about here, which is for the general indoor environment that the public frequently assesses and aims at protecting the general population, including the most vulnerable ones. So setting the comprehensive IAQ legal limits or standards, or even sometimes the guideline values have been very challenging, because I think what we know about indoor air science and health effects from indoor exposures are still limited. For example, there are new chemicals continuously being introduced to the indoor materials and products, and there might be possible substances of concern that have not been yet identified indoors. And even with those identified indoor pollutants, they come from a variety of indoor and outdoor sources, and it is still challenging to develop a generalized list of pollutants of concern for all indoor environments, and further to establish those science-based, substances-specific standard or even guideline values for all those contaminants. But on the other hand, fortunately, there are some examples of successful regulations that are originated from California. For example, the airborne toxic control measures for limiting formaldehyde emissions from composite wood products, as well as clean air cleaner regulation to limit ozone emissions from potable air cleaners. So both was actually done by CARB. So we really hope that this can happen again with this update of indoor NO2 guideline lead by CARB. In terms of the IQ related activities for the general environment at CDPH, this is mainly conducted at the air quality section in environmental health lab branch. Our section has a team of multidisciplinary expertise, and our mission is to promote the health indoor and outdoor air for all Californians. Although we haven't done any specific work related to NO2 guideline development, we have plenty of experience in working with various stakeholders and have successfully developed a few important IQ guidelines for California. For example, we have developed a standard testing method for the testing and evaluating of the volatile organic compound emissions from building materials, also known as CA Section 1350. And this method has been widely used and has been adopted in Cal Green Building Code for requiring low-emitting building materials. We have also developed a statement on the building dampness, mold, and health, which has been cited in the California Health and Safety Code for substandard housing. And during COVID, we have developed technical guidance documents on ventilation and filtration with collaboration with other agencies. So more recently, we have started an interagency state IQ task force. This is an initiative inspired by the governor's Smarter Plan. And the governor's Smarter Plan was released in February last year for the next phase of California pandemic response. So this California interagency state task force was established with a primary focus of improving IAQ for the purpose of controlling airborne transmission. But we hope it can ultimately be a platform for state agencies to work together to advance the short and long-term IAQ activities in the state. So this graphic here illustrates what this IAQ task force I just mentioned is currently working on, the progression of the expected deliverables from this task force, as well as where they are situated to achieve the ultimate goal of improved IAQ in the California state. So our view is that we can start with greater public education and workforce training and promote innovation in IAQ space through the award grants created by CDPH. So the reason is that we found most current IAQ programs in California are actually non-regulatory. So we think it's really important to continuously educate and motivate people to take voluntary actions to improve IAQ in their own environment. Meantime, in the next few years, we also want to work on a report that summarizes available standards and guidelines and recommend the best strategy to implement them in California for the purpose of controlling airborne pathogens. We also plan to create a broader roadmap and action plan on how more comprehensive IAQ standards or regulations can be developed and implemented in California. So with this IAQ task force I just mentioned, we have conducted a survey about the existing IAQ program activities, authorities, as well as gaps among the California state agencies, including those related to NO2 guideline development. And the survey results actually indicated that only CARB has a recommended maximum indoor NO2 exposure levels for homes that was originally published in 1994 and later included in the 2005 report to the IQ report to the state legislature. So we can see there's a clear need for updating the NO2 guideline, which with CARB naturally being the lead agency there. Then the next question is that currently the best time to update the California indoor NO2 guideline? And we think the answer is probably yes. So as we just heard from May and other presenters in this workshop, during the past 30 years, much more work has been done by Health Canada, US EPA, and other organizations worldwide on health risk assessments for NO2. We now have better scientific evidence on the health effects of NO2 exposure at indoor levels lower than the maximum values previously recommended in 1994 by CARB. And also, I think we have better understanding about the indoor NO2 sources and exposure levels in California homes now. For example, with the funding support from CEC, the California Energy Commissioning, scientists at Lawrence Berkeley Lab have conducted multiple field studies and provided data about the NO2 and other pollutant concentrations and their emission rates from indoor combustion cooking devices in homes with a variety of ages and ventilation features there. So besides our knowledge increase on the health effects as well as the source and the strength, I think nowadays we also have better technology and product advancements, which makes the NO2 source reduction and mitigation in indoor environment more practical. For example, as May just mentioned, residential gas cooking appliances can be a significant source of indoor NO2, especially for the short-term exposure. And nowadays, there are alternative electric stoves are commonly available today, and they can use to eliminate such NO2 source. And even one prefers to use a gas stove still, then the energy efficient vented range hoods are readily available in market today so that they can better remove the NO2 near the source. So I think with all this research and technology advancement, it will really help us to finish the updating of the indoor NO2 guidelines here. So finally, I just want to quickly discuss.
And just 1 minute, one legend, okay, 1 minute. Thank you.
Yeah, how this indoor NO2 guideline may be used once they are updated. So like all the other IAQ standards and guidelines, I think additional guidance or standardized protocol on its monitoring environment may be needed. And nowadays we see a general trend of using real-time IAQ monitoring, using low-cost sensors to monitor IAQ. And I think the same trend may apply to NO2 as well. Then we need to consider, how to evaluate those low-cost NO2 sensors, the calibration requirement, detection limit, and field using reliability of all those sensors. And then another hot topic that I think updating NO2 guideline may potentially have impact, maybe with the continuous movement related with the building electrification. So with the scientific evidence discussed today, we certainly want to eliminate all the indoor NO2 sources like gas stoves. But on the other hand, there may be other potential equity and security issues with building electrification. I know this is not the focus of the workshop today, but I think maybe this is something we should keep in mind when setting any NO2 guideline indoors over long term. So basically, that's the end of my presentation, and I just want to acknowledge all my CDPH colleagues who have contributed to this, and thank you very much for your attention.
Thank you very much for the great presentation, Dr. Chen. And we will move to next presenter, Dr. Melinda Dent. Would you please share your screen? We can't see your screen yet. Oh yeah, can you put it on presenter mode?
All right. Can everyone?
Yes. Great. Yeah, looks great.
Perfect.
Thank you. You can move forward.
All right, awesome. Good morning, everyone. I'm happy to be here to provide an overview of the CEC-funded research efforts to measure indoor air quality, especially nitrogen dioxide, the pollutant of interest that we are discussing today for CARB's indoor air quality guidelines. All right, so I don't need to go into details of this slide, as we have already learned about nitrogen dioxide from the previous speakers and presentations. But the key takeaways from here are that nitrogen dioxide is a health damaging pollutant. Acute and chronic exposure to it can cause respiratory issues, especially among children. And combustion activities such as cooking using gas stoves, especially when it is not vented to outdoors, can produce high levels of nitrogen oxides in indoor spaces. And also now we have a sense of indoor air quality standards and guidelines from previous speakers. This table presents that summary. And as you can see in this table, among the standards and guidelines in the US, the EPA's short-term 1-hour NAAQS for NO2 is the most stringent, and CARB's standard for chronic exposure is more stringent at 30 parts per billion. We can compare these standards with Canadian and WHO indoor NO2 guidelines, which previous speakers talked about, and we see that those are more stringent than NAAQS and CARB guidelines. All right, so I included this slide upfront to signify Energy Commission's authority for indoor air quality through Warren-Lundquist Act, from which this PRC code is referenced, which gives CEC authority on indoor air quality. Title 24 of the California Code of Regulations has Part 6, also called California Energy Code or Building Energy Efficiency Standards, which is a key means for the state to implement energy efficiency in buildings and contains requirements to improve indoor air quality in newly constructed buildings and additions and alterations to existing buildings. So as buildings have been tightened to improve energy performance, the dilution of indoor air through natural ventilation has been significantly reduced. So as a result, the importance of controlling indoor pollutants generated indoors has increased. Additionally, many building occupants do not open the windows regularly to get natural ventilation. So much of our early CEC research efforts have delved into issues that impact ventilation-related requirements for Energy Code. Since 2008, the Energy Code has incorporated residential mechanical ventilation requirements, and these were updated just last year and effective this year in 2023 to include health protective capture efficiencies and airflow rates for kitchen range hoods with guidance from the CEC-funded research work, which I will also highlight later in the slides. CEC updates these standards every 3 years. Next in the line is 2025 Energy Code, for which work has already started. All right, so I don't expect you to go through this text-heavy slide, but I wanted to include this slide to acknowledge that GAS R&D and PEER and EPIC program funding has supported a large number of important studies in the air quality, energy, and health space since early 2000s. This slide highlights some of our publications in this space. Many of these studies included measurement of criteria pollutants, including nitrogen oxides, using both field and modeling or simulation approaches. Okay, so with this background, here's the outline for the remaining part of the presentation. Today, you will hear about some of our historical work, which largely focused on building code and related air quality issues. I'll keep focused on the results for indoor nitrogen dioxide from residential sources, but also share other relevant results. Then I will provide a glimpse of some of our ongoing work and future directions, which extend beyond our historical focus on building code and indoor air quality to shed light on issues related to decarbonization and health with a lens on equity. Okay, so this early CEC-funded research published in 2009 was the first of its kind field study of California homes less than 5 years old that established a need for mechanical ventilation in tightly sealed homes with low air exchange rates. Data from this work directly informed the CEC's 2008 Title 24 Building Energy Efficiency Standards. The study measured and characterized indoor air quality for many pollutants, including nitrogen dioxide, fine particulate matter, and formaldehyde. From the measurements in the sample of 29 single-family homes, researchers find that none of the indoor NO2 concentrations exceeded CARB's indoor guidelines for 24-hour average concentration. Most of the homes sampled had electric stoves, which likely contributed to the lower NO2 levels in homes. Also to be noted that in this work, CARB used, the researchers used the CARB's indoor NO2 guideline as a benchmark, which is quite relaxed compared to ambient standards. In this study, the only indoor air contaminants that were found to exceed recommended guidelines in most homes were formaldehyde and some other volatile organic compounds. Okay, another study published in 2013 using modeling simulation to calculate time-dependent concentrations of nitrogen dioxide in a large sample of homes in Southern California. The modeling here estimated that more than half of the residents in homes, more than 6,000 in Southern California, that cook with natural gas without regular use of vented range hoods are exposed to nitrogen dioxide at levels that exceed federal guidelines for acute exposure. When an intervention such as range hood was used, the percentage of homes with an exceedance for nitrogen dioxide from ambient standards was reduced from 50% to 15%. The study results also showed that PM2.5 and formaldehyde are other important indoor contaminants that exceeded thresholds. Okay, CEC-funded research also supported a research to explore holistic frameworks to evaluate and consider indoor air quality impacts of building energy retrofits. In this field study, in a small sample of apartments, researchers showed that in the apartments with gas stoves, with standing pilot lights, as shown in the figure here as B1 apartments, average indoor NO2 concentration decreased by more than half after the retrofits, such as replacement of the stove to eliminate the pilot lights were installed. Okay, so another effort was a large-scale field study with more than 300 California homes. This work investigated the short-term indoor air quality impacts of using natural gas cooking burners through controlled experiments in 9 residences in Northern California. Study found that moderate gas burner use with no actual cooking and no mechanical ventilation produced nitrogen dioxide concentrations that exceeded the 1-hour outdoor air quality standard in 4 out of 9 Northern California homes and was more than half the standard in 2 others, suggesting that significant NO2 exposures may occur for anyone at home when natural gas burners are used for even a single substantial cooking event. Study also indicated that range hoods can substantially reduce cooking burner pollutant concentrations both in the kitchen and throughout the house. Additionally, the control experiments conducted in the study indicated that for some advanced technology water heaters, there was an increase in NOx emissions with increasing watt number. Okay, so now let's jump into more recent works that measured NO2 in homes with mechanical ventilation. So as I described, some of our early work drove the need for mechanical ventilation in new, tightly sealed homes. To get a sense of how well ventilation systems were working, we funded a survey and field study of 70 homes built between 2011 and 2017, which evaluated how ventilation systems were performing in new California homes with gas appliances. The study found that measured concentrations were below health guidelines for most pollutants, including nitrogen dioxide, indicating that indoor air quality is acceptable in new California homes when mechanical ventilation is used. However, survey results indicated that labeling and controls for ventilation systems need to be improved. The survey results also indicated that the vast majority of California homeowners do not open their doors or windows in the winter, and a quarter of California homeowners never open their doors or windows, regardless of the season. This indicates an ongoing need for mechanical ventilation, as a substantial fraction of the population will not open windows to provide natural ventilation on a regular basis. All right, so this follow-up study published in 2021 more recently focused measurements in smaller homes and in new and renovated low-income apartments. The previous one was on larger homes, focused mostly on larger homes. And the measurements of nitrogen dioxide and PM2.5 in apartments and houses with code-compliant mechanical ventilation suggested that in a substantial minority of homes, concentrations may exceed health-based limits. For example, 3 apartments had indoor NO2 concentrations above California ambient air quality standards of 30 parts per billion during the week of monitoring. Additionally, formaldehyde concentrations were lower in apartments than in houses, but still were found to be routinely above the chronic reference exposure levels set by CARB. This research found that minimum airflow requirements are inadequate to ensure sufficient pollutant removal and provided data to substantiate the use of capture efficiency in California building code as an improved metric for range hood performance. So it provided direct support to 2022 building energy efficiency standards by adding health protective capture efficiencies needed to meet 24-hour fine particulate matter threshold value and 1-hour nitrogen dioxide threshold value. Before this, there was no standard test or rating system for capture efficiencies for residential cooking exhaust hoods. Okay, so this was our very recent effort, which is under review of a field study that measured pollutant measurements in 76 homes across different seasons. And yet, once again, we see that concentrations of nitrogen dioxide and PM2.5 in many homes exceed annual ambient health standards. Health risks from gas cooking appliances are higher in low-income and under-resourced communities. Okay, so now I will discuss our ongoing work and future work in this space that can inform benefits of clean energy interventions by removing sources of nitrogen dioxide and PM in homes. So we kicked off this APIC-funded project in October last year regarding cooking electrification and ventilation improvements for children's asthma, also called SAVICA study, which is awarded to LBNL, and Brett Singer, who is also present here, is lead on this, and it's conducted in collaboration with UCLA, UCSF, Association for Energy Affordability, and the Central California Asthma Collaborative. This is our group's first effort to directly measure health outcomes of clean energy interventions among a target population. This effort will look at impacts on multiple kitchen electrification interventions on the indoor air quality, especially for nitrogen dioxide and PM2.5 concentrations, and health outcomes for asthma among children. Multiple interventions will be tested, which includes replacement of gas ranges with electric induction, kitchen ventilation, and use of 120-volt countertop electric appliances to reduce gas range use. Initial results from this work are expected by 2025, just in time to possibly inform 2028 standards. Okay, so with gas R&D funds, we have the opportunity to support more work in the area of indoor air quality, indoor air pollutant exposures. Through research funded by a future solicitation, we'll quantify and characterize residents' exposure to indoor air pollutants generated from kitchen stoves. It could be gas, electric, and induction in a multi-family home setting, considering factors such as human behavior patterns and socioeconomic factors.
1 minute, Meninder.
Okay. Right. Additionally, we have more research coming through APIC4 and gas R&D funds that will understand the benefits of building electrification interventions. All right, let's jump on some of the common findings from the past research work that I highlighted before. Consistently, time and again, we have seen homes with unvented gas-fired equipment generate NO2 pollution that can exceed health-based standards. Mechanical ventilation in kitchens, such as range hoods, help lower nitrogen dioxide concentrations to safe levels. And as demonstrated with 2022 building energy efficiency standards, it is possible to set scientifically informed ventilation standards that are both protective of human health and also avoid unnecessary expense on energy costs. This benefits especially smaller homes and homes in low-income communities. Though there are some challenges as well. For example, old building stock in California presents an issue to which new requirements in the code do not apply. For example, in California, more than 90% of single-family detached homes and about 78% of apartments were built before 2012. And adoption is also an issue. For example, per 2019 RAS data, only 28% of single-family homes have electric cooktop at present. And there's a challenge of operational deficiencies that impact performances of mechanical ventilation systems in low-income housing. And also to be noted, since pollutants are generated from cooking regardless of energy source, swapping gas cooking appliances with cleaner options does not eliminate the need for effective kitchen ventilation. However, as seen from the capture efficiencies required for electric or gas ranges in energy code, the exclusion of gas helps to lower concentration of pollutants, especially nitrogen dioxide, and provides more flexibility in kitchen ventilation use. And there are other pollutants of high concern that need attention, such as PM2.5 and formaldehyde, as they are found to routinely exceed chronic reference exposure levels set by CARB. And to finalize, more research is needed to characterize emissions from cooking activities, regardless of fuel type, understand actual exposures of cooking-related NO2 and PM2.5 emissions to residents, and develop ventilation and control strategies that are effectively used by California residents, and as well as quantify health and related monetized impacts of electrification interventions to support building decarbonization and improve residents' health. So that concludes my presentation. Thank you.
Thank you very much to Dr. Thing, and also thanks again to all our three speakers. And we're open to question now. If you have any question to our panelists, please raise your hand, or you can type it into our Q&A sections, and we will read it out. So before we receive more questions from the audience, I have a question to all three of our panelists. So as we each agencies have their own expertise and their own mission goals. So can you talk about like how we can harmonize each state agency's efforts and needs for indoor air quality and the IAQ guidelines? Who want to start?
I can start.
Yeah, please.
Traditionally, OEHA served as the research foundation of all Cal EPA agency, the whole agency. So we conduct a health review to provide the science-based basis for the standard development. It's kind of like WHO's role, and provide a health guidance, a reference level, and then CARB apply the policy consideration on top of that, and to decide the final standard. I think CDPH may be more towards to communication to the public. I'll leave that to Wenhao.
Yeah, so thanks, Zoe, for the question. Yeah, I think it's a really good question. Like, as I mentioned during the presentation, so I think, certain type of state interagency task force will be needed to coordinate the efforts, at least, to let state agencies know what each program is doing, so we avoid the kind of duplicate efforts, and then trying to concentrate our resources, to the most needed, like, development together. So that's why I'm mentioning that Indoor Air Quality Task Force also, although it was originated for, for the improving IAQ for controlling the airborne transmission, but I think over long term, it can be used as a platform for the state agencies to work together. So that's my thinking. And then the second thought is, like, I think anything like related with, initial guidelines, or maybe later trying to make it more like adopted or, implemented in practice. So I think, that is a long line of the process. So when we do that, we should try to involve the relevant stakeholders as much as possible, even we are doing the guideline or the voluntary document that will help to facilitate the adoption of the guideline by the market or by the, the building code or regulation bodies, so that it can have the real sort of implementation in the practice. So that's kind of my opinion.
Thank you. And Dr. Thing, do you have any?
Yes, I can add that, as I mentioned during the presentation as well, that CEC has put in efforts before to provide the science-based evidence on the impact of indoor NO2 concentrations on residents' health. And as I mentioned, time and again, we've seen homes with unvented gas-fired equipment generate NO2 pollution that can exceed health-based standards. So we, through our funding mechanisms, including gas R&D funds and EPIC program, we have the ability to provide the science-based research and evidence on the impacts of NO2 on human exposure, and also influence and provide guidance to the Title 24 building standards for Part 6, which is also called Building Energy Efficiency Standards, where, as I gave you the example, that the 2022 Building Energy Efficiency Standards had guidance from the research that was funded through the different programs and impacted to include the health-based thresholds for kitchen mechanical ventilation. So that's my take, and CEC's authority on indoor air quality through providing the science-based evidence on the impacts of NO2 and other pollutants on human exposure.
Thank you so much. And do we have any questions from our audience? Well, I see now. And do we want to have a break now, Jeff?
Yeah, I think this is probably as good a time for any, but before I let everybody go, I actually have a question for Wen Hao. This is more of a personal thing, but we had talked a little bit about it amongst ourselves. In terms of monitoring, you mentioned low-cost NO2 monitors, and I think that's wonderful. Info is power for folks who are curious about where their indoor air quality is headed. My experience with NO2 monitors is that they tend to be a little finicky and not necessarily terribly accurate because of interfering substances. I'm wondering, how do you envision those being used? Maybe just as a way to see if things are increasing or decreasing. I'm not sure that they're actually going to provide a particularly accurate result, but maybe just for trends. What are your thoughts?
Yeah, so I understand what you're talking about. I think you raised a very good point there. So Jeff, I'm just mentioning it because I think, I saw in general, because, there's an overall trend of, the real-time monitoring, not only on the NO2, but also general like low-cost PM sensors have now, been widely used. And
Right.
Also the CO2 monitor, it has been kind of, promoted to be used in buildings. And now, California, there's new requirement on schools to have, CO2 monitors in each classroom and in the university's classroom as well. So I think there's a general trend to have the continuously monitoring, of the indoor air quality, and then that will give sort of a real-time response, and then certain control may be kind of, implemented based on that. For the NO2 specifically, honestly, I think, the research, I mean, at CDPH AQS, we have done very limited research on NO2 specifically. And I think, there are like other methods, like, passive air samplers, or more like research grade chemiluminescence analyzer for, analyze the NO2 concentrations there. And I think maybe initially, we can allow like, 1 hour or 24-hour average using other methods. But from the data, we saw, there are sort of acute or short-term exposures, during the cooking events. And I have, I'm just thinking, long-term wise, maybe we're still trying to, push the industry to develop more better advanced NO2 sensors, and then that can be used over the long term, So that's just the general trend I'm seeing for now. Maybe it's not ready. So maybe, we should rely on more traditional method when establishing the NO2 guideline or updating it, initially. But I think over long term, that can be a research direction we go. So that's kind of what I'm thinking. Thank you.
Thanks, Wen Hao. I'll hand it back to Zoe. I see we have a raised hand. So
Yes, we have a question from LaDonna Williams. Could you please unmute yourself and ask your question? We can't hear you yet. Oh, yeah. Please go
Okay,
ahead.
can you hear me now?
Yes, please.
Oh, okay. I have something on my screen that keeps saying can't allow. It's not allowing me, but you can hear me. So
Yes, yes.
thank you for this. This is really informative, but at the same time, it really creates an urgency for communities like mine. I live pretty much, we're a refinery town. We have railroads that come through our communities, directly to through our communities. We live across the street from raw sewage plants. And we've been told over the years, pretty much the trend, I should say, is outdoor monitoring. When many of us have been saying, but these odors and these smells that we constantly encounter, we knew that we needed indoor monitors. So we would push, and we finally got, maybe was it last year, or year before? Time is going by so fast. Maybe it was 2021, indoor air filters, the HEPA filters. We don't know if it's psychological that it appears to be somewhat helpful, but we have gauged asking some of the households, do you think these filters are better? Is it worse? And we got a few good positive feedback where they said, well, you know, my kids were constantly, and this is a household that may have more than one kid. They said my kid would be constantly sneezing or constantly coughing. But then when they got the HEPA filters, they noticed they were sleeping through the night, and it was less, you know, allergic reactions. But hearing this, you know, it's almost like, what recommendation do you give to particularly, say, public housing residents or Section 8 residents, where most of our residents are built on toxic dumps? Now we've got to worry about, you know, the NO2 emissions. Are they elevated? Are they not? Changing the gas stoves out to electric, which for our communities is going to be very slow. What can we do as residents with this information that you all shared? And by the way, it's not personal to you, Ms. Chen, but just to know that the California Department of Health has done very minimal, you know, research and programs related to this, and especially with communities. What are we to do? And when we're literally taking our parents to the hospital, you know, battling cancer, and many of us have health problems ourselves, what can we do in the meantime that would put some sort of protection, some sort of barrier? Is it change behavior? It's something we have to do, but it really creates an urgency for us.
And I do want to just interject. Thank you very much, LaDonna. I appreciate that. That in the later part of the presentation, we're going to hear a little bit about more about strategies to reduce exposures indoors. So we will certainly be getting to that. But you know, I don't want to prevent any of the panelists from answering your questions. So I'll pass it back to them. But also we will have some time at the end of the workshop to go more broadly into those questions. So I'll hand it back to Zoe.
Yes, and thank you, Jeff, for jumping in. Thank you, LaDonna, for this question. Yes, we will have a panel specifically talking about community concerns. So maybe I think it's a good time to take a break, and we will revisit that question unless the panelists here want to provide some immediate answers to it.
Yeah, I just want to quickly say a few quick words. So first, thanks, LaDonna, for your question. I think as for your general question of the California Department of Public Health work, so, you know, our air quality section, you know, we are sort of, you know, doing research work. And then, as I said, you know, there's interagency task force. So basically they coordinated efforts between different agencies. And since CARB has already started work on AO2, so, you know, they are the leading agencies basically for updating this guideline. But in general, for the indoor air quality, I think California Department of Public Health has, you know, generated a lot of, you know, general education materials for the general public. We have environmental health investigation branch as well. So they reach out actually to the communities, you know, for the, you know, air quality monitoring project. And, you know, we have biomonitoring. So basically we are closely monitoring to the exposure levels of the different chemicals among the Californians. So I think there are are lots going on inside the CDPH Department of Public Health. So we are trying to help to address all, those related questions. Of course, there's a long way to go. As I said, indoor air quality is much more complex compared to the, very sort of, outdoor ambient air quality standards. There's a lot of unknown characteristics. And there's a different types of indoor sources of pollutants and the long list of the different type of the pollutants. I mean, we are talking about things here is most like chronic long-term exposure effect. So basically it is not really it's not like a direct life-threatened type of, the exposure levels. So those levels are, as I said, that's legal limits from the, the workplaces, at higher concentration levels. So here we are talking about the indoor air quality guidelines that for the long-term production of the building occupants. So, so basically what I want to say is like, don't be freaked out, by the things we are talking about here. We are trying to help, and now we are trying to improve the California's health over long term. But basically, I think that's our final goal, and we are trying to achieve there through the civil work and through the collaboration of the different agencies. Thank you.
Right, but it's
Thank you.
also important to get input. I get it, Jeff, but hold on a second, please. It's also very important to get input from the community, because you guys are seeing it from an agency level. We're at the community level. We're that very impacted, overburdened community. And it is not reaching our communities. I'm getting texts right now from others that are on this call that live in disadvantaged, not just underserved, but disadvantaged communities. And yes, we've engaged with all of the agencies from yours to DTSC to, air, water. But this is not reaching our communities in the way that it needs to, so that we can begin to protect our families.
Great,
Hi,
thank you.
this
Go ahead,
is
Bonnie.
Bonnie Holston. Hi, LaDonna, and I just wanted to thank you for your comment. And that's exactly why we're having this workshop, is to talk about the public health concerns, indoor air quality, specific to NO2, to hear comments from you and communities, as well as other experts and interested parties. So, I mean, your comments are really important to us, and we know there are special concerns in affected communities, and communities, as you said, that already are experiencing a lot of other sources of pollution, and we have to be concerned about those combined effects that communities are experiencing. We do have a lot of resources available now for communities in terms of ways that people can create clean air spaces in their homes and try to reduce the pollution exposures as much as possible indoors. And I know our staff is going to be putting some links to some of the information we do have. And as Zoe mentioned, we have a panel that's coming up right after this break, which is going to focus more on community perspectives. So I hope that you will stay, and we'll have more time for discussion after we hear from our different community representatives. And I know many of them will touch on some of the concerns you've raised. So I'm just going to say, so we do need to stop and take a break for now, but we're going to get back to this after our community panel. And I believe that all of our speakers, as many as can, will be staying also. So we'll also have time at the end for further discussion, but we'll be definitely putting some links and some information. And the concerns you've raised are exactly the kinds of concerns that we want to incorporate into this discussion of our indoor air quality guidelines. So thank you.
Great. Thank you, Bonnie. Okay, we're going to take a 5-minute break. We're running a little bit behind, so when we get back, we'll get started right in 5 minutes. So it's 11:03. Let's get back at 11:08. Yeah, so we'll see everybody in about 5 minutes. Thank you. Okay, welcome back, everyone. So I'd like to move on now to our third group of distinguished panelists. Looking forward to hearing about this. And our moderator for this session is going to be Victoria Villa. So I'm going to go ahead and turn it over to her. Victoria?
Thanks so much, Jeff. Hi, everyone. Welcome back. So my name is Victoria Villa, and I'm an air pollution specialist with CARB. I'll be your moderator for the third panel with our nonprofit and community group experts. They'll be presenting the community perspective on indoor air quality and guideline development. Our first panelist is going to be Annie Carforo. Annie Carforo is the Climate Justice Campaign Manager at We Act for Environmental Justice. She holds a Bachelor's of Science degree in Human and Organizational Development with focus on community development from Vanderbilt University and is currently pursuing a Master's of Urban Planning degree at Hunter College, with a focus on equity and sustainability in city planning. Please help me welcome Annie Carforo.
Hi, thank you so much for having me. I'm not sure if I should share my screen for my slides. Okay,
yes,
great.
Please, go ahead.
Great. Thank you so much for having me. I am calling in from New York City, so I appreciate being able to provide the insight that I have on this issue, and listening to the conversations that have been had so far. I think that in a lot of ways, New York and California are in very similar situations. There's a lot of efforts that are being made, and yet there is still this issue of how do we make sure that our reach is equitable and that it is targeting, interventions are targeting populations that have been historically and disproportionately exposed to harmful pollution, both indoors and outdoors. So We Act as a community-based organization. We were founded in West Harlem, which is part of Northern Manhattan. It's a historically Black community. We've been advocating to fight against the environment and the racist siting of a number of polluting facilities in that district, and now have become really watchdogs at the city, state, and federal level around for environmental justice. And so I'm going to be talking about a pilot project we recently completed called Out of Gas In With Justice. And I'm going to jump right in because I have limited time. But Out of Gas In With Justice was the first pilot study of its kind that focused on the effects of residential cooking electrification with tenants in place in a public housing setting. So we conducted our pilot at a New York City Housing Authority building in the Bronx, New York. And what we did was we switched out 20 of the stoves in the 96 unit building. We switched them from gas to induction stoves. And throughout that process, we monitored the air quality to really measure the improvements to air quality when transitioning from gas to electric. And our pilot confirms that decarbonization is really key to realizing a healthy home that so many members of our community are currently deprived of. So we had both climate motivations and health motivations to do this study. In New York City, buildings are responsible for 70% of our greenhouse gas emissions, so they are definitely a target for decarbonization. 70% of our population is also renters, and 50% of our renters are rent burdened. And so we have a lot of renters that are in very vulnerable positions, but would really benefit from a lot of these interventions. In New York State, air pollution leads to nearly 2,000 premature deaths annually. We also, in New York City, have a higher than the average asthma diagnosis. So 10% of our population has asthma or has been diagnosed with asthma. 18% of childhood asthma has been attributed to gas stoves in homes. In New York State, nearly 60% of homes have gas stoves. So this is a really big issue over here. And we've seen in studies that living with a gas stove can increase a child's risk of developing asthma-like symptoms by 42%. I want to touch quickly on this asthma issue because this is a real environmental justice crisis that exists in New York City. 80% of hospital visits for asthma in young adults and children identify as Black or Latinx, which is, again, a direct result of disproportionate siting of polluting facilities in these neighborhoods, and then also a combination of having older, inefficient housing stock that is, poorly ventilated and can lead to really high concentrations of indoor air pollution as well. And this map on the left just shows the 5 boroughs of New York City, and is in with asthma hospitalizations for both young children and young adults. And you can see a higher concentration in boroughs like the Bronx, New York, and Upper Manhattan, particularly East Harlem, two neighborhoods that have a larger population of communities of color. So our pilot was, we reported the health and social impacts of this transition from gas to induction through 3 tests. We did long-term air monitoring. So we, over a 10-month period, monitored the air in our 20 participants' homes for a week at a time, for 3 weeks total. 10 of the apartments received the induction stoves at the beginning of the pilot. 10 of those apartments kept their gas stoves so that we could have a control test. However, we installed gas stoves in all we installed induction stoves in all participating apartments at the culmination of the study. We also ran a controlled cooking test to really isolate the stove to understand what air quality looked like when people were cooking on a gas stove versus an induction stove. And then finally, we conducted stove usability focus groups to hear from our participants firsthand their experience with electrification in this transition. So the results from our long-term air monitoring, we found that just by removing the gas stove from people's homes, it's worth mentioning that this building had recently flooded and so was operating on a mobile boiler that was in the backyard that was running on oil. And so we know that there was some interference from that, but what we did find was that in people's apartments, just by removing the gas stove, there was a 35% reduction in daily nitrogen dioxide concentrations, which is an incredible, pretty incredible for just one intervention. And we found that the highest concentrations of nitrogen dioxide were virtually eliminated when transitioning to an induction stove. We found that households with the gas stove were exposed to NO2 concentrations above what is considered safe for outdoor exposure set by the EPA's AQI, which I'm going to get into in my next slide. We also did measure carbon monoxide, which I'm not going to spend too much time focused on for this conversation, but we did find a significant decrease in carbon monoxide from 1.4 ppm to 0.8 ppm in households with induction stoves, which again was significant, but was not at levels that were overly concerning, I would say, in gas stoves. So what we did to kind of better paint a picture of what was happening to air quality in people's homes was we looked at the percent of hours that people were exposed to different quantities of nitrogen dioxide. So we compared people's air quality to the World Health Organization's indoor air quality guidelines of 13 parts per billion. And we also looked at when air quality inside people's homes went from good to moderate on the EPA's AQI, because considering we were indoors, we did want to, and these are outdoor air standards, we wanted to see kind of what was happening inside people's homes in terms of nitrogen dioxide concentrations. And so this graph, just to orient everybody, we have our 20 households on the bottom, our 10 households on the left side had their gas stove for the entire study. The 10 households on the right side had their gas stoves at the beginning of the study and then replaced them with induction stoves. And we're looking at the percent of monitored hours in each household, where if it's green, the air quality was less than 13 parts per billion. If it's red, it was greater than 54 parts per billion, which is on EPA's AQI, where air quality goes from good to moderate. And then the yellow is kind of this in-between area where it's higher than the World Health Organization's indoor standards, but it's still considered good for outdoor air quality by the EPA. And what we found is that in the baseline part of our pilot, this is when everybody had their gas stoves, we saw incredibly high rates of nitrogen dioxide across the board. It's worth mentioning that these data sets were taken between the months of October and February, which are historically cold in New York. People were more likely to have their windows closed or reported having their windows closed. Also, people reported to us that they had ended up using their ovens as supplemental heating for parts of the air monitoring time, which we did see, led to pretty high concentrations of nitrogen dioxide. But what we found in the follow-up when we replaced 10 of the gas stoves with induction stoves was that we virtually, like I said, eliminate those highest concentrations of nitrogen dioxide that are considered moderate on the EPA's AQI. And moderate, again, has, could have impact on sensitive groups, which in our study, 85% of households, just based on age alone, were considered part of a sensitive group. And just a quick zoom in here, we do see, just by removing the gas stove, again, this elimination of hours in the day, that air quality was, the nitrogen dioxide concentration was above 54 parts per billion. It is worth noting, though, and as I said before, with the mobile boiler, that we did see air quality in people's homes who had induction stoves that was still above what the WHO determines as safe for indoor air quality. And we contributed this to a number of other confounders, including the boiler, including the fact that, neighboring apartments still had their gas stoves. There, were busy streets outside. This is a neighborhood that has higher concentrations of outdoor air pollution. And so I don't want to, put too much emphasis on the fact that the stove was the be all end all solution, but it definitely had a very positive impact on air quality. I just discussed that, so I'm just going to move on. Really quickly to discuss our controlled cooking tests. So again, we wanted to isolate the impacts the different stove types had on air quality. And so we cooked the same meal, measured out at the same temperature in the same order in 6 different homes, 3 different times. So 18 times total. 9 of those cooking events, we were in households with gas stoves, and 9 of those cooking events, we were in households with induction stoves in the building. And we measured nitrogen dioxide while we were, throughout the cooking event. And what we found was that households with gas stoves had NO2 concentrations that were on average 190% higher than households with induction stoves. We took measurements of background NO2 before we would start cooking, and we saw that households with gas stoves, were starting at about 18 parts per billion and would jump up to on average 197 parts per billion. In certain households, and I can say this firsthand because I was there, that had older stoves that didn't have great ventilation, we saw concentrations of nitrogen dioxide reach 400 parts per billion, which is incredibly concerning. However, in households with induction stoves, we saw virtually no difference between background NO2 and when somebody started cooking. And this is just a clearer snapshot. This was one cooking event on a gas stove and one cooking event on an induction stove that were of similar length and time. One of the benefits I will mention of the induction stove is that it cooks a lot faster. And so our controlled cooking test ended up moving much quicker when we were using the induction stove than the gas stove. But these 2 cooking events were of similar time and just shows the drastic increase in nitrogen dioxide when using a gas stove versus no increase when you're using an induction stove. And what we saw was that for 43 of the 45 minutes we were cooking on a gas stove, the NO2 concentrations were above the EPA's threshold that is considered unhealthy for sensitive groups. Last but not least, the stove usability focus groups. This was one of our favorite parts of the study, was really getting to sit and talk to the participants about their experiences. I'm happy to report that our participants unanimously love their induction stoves. This transition went much smoother than I think any of us were anticipating or expecting. People love the stove for a number of reasons, between, the quality of the cooking, the speed at which it cooked, the ease of cleaning the stove, but also the sense of safety that they had not having gas in their homes, not being concerned that they might have left the gas on, or, many of them had young kids or pets, not having that worry of burning or setting something on fire. They also did mention, that they anecdotally had, again, much easier times breathing. There was less coughing. I think we did not measure, and this could be like a further research question about the actual impacts on health. But there was definitely some of that, mentally people did feel that their air quality and their quality of life had improved.
1 minute, Annie. Looks
Yes.
like you're about there.
Yes, I am done. I think that just some key takeaways from our pilot, and again, this was very specific to New York, but gas stoves in homes, especially older homes that have poor ventilation, they do lead to high concentrations of NO2. These are the populations that we want to be targeting with these interventions, because many of them are considered part of sensitive groups. and that induction stoves are welcome and viable electrification solution for low-income households. Our participants love their stoves unanimously. We have not had a single person come to us with, after a couple of months with their stove saying, I hate it. Everybody really has just truly embraced it and grown with it. We do see the need to transition entire buildings. As we mentioned, there were confounders in our study that were impacting NO2 concentrations in people's homes, and that is, an area for future research. And I think just, this is New York context, but we do need to make sure, and I'm sure this applies to California, that as we are targeting these interventions at low-income communities, at environmental justice communities, we need to make sure that there are robust tenant protections in place so that people can stay in their homes and really reap the benefits of these new technologies. And thank you so much for your time.
Thanks so much, Annie, for sharing the pilot project and its findings. It's very informative. Next, I'd like to introduce our following speaker, Kevin Hamilton. Kevin's education includes an associate's degree in respiratory care, bachelor's degree in geology, and extended coursework in social work, mathematics, business, and management training. As co-executive director of the Central California Asthma Collaborative, Kevin is focused on reducing the burden of chronic respiratory disease and environmental health impacts valley-wide. Kevin serves on numerous boards and communities associated with grassroots community capacity building and local, state, and regional policy development. Please help me welcome Kevin Hamilton.
Thank you. I appreciate your time today. Let me just go ahead and share the screen here. There. All cool on your end? Everybody can see?
Looks good.
All right, great. Thank you. So Central California Asthma Collaborative is, on the face of it, not the organization you might expect to be in this conversation at this time. But CCAC does aim to provide education, direct services, build regional capacity, and advocate for sensible policies that improve health and address inequities by reducing environmental impacts and emphasizing the prevention and management of chronic disease. It's a big statement. And here in the San Joaquin Valley, where we live and breathe every day, we're fully cognizant of the fact that this valley is the dirtiest air basin in our nation. Violates NAAQS standards for PM 2.5 and ozone well over 150 days every single year. So not only is the indoor environment potentially hostile to many of our residents, but the outdoor environment is as well. So it's a double threat. CCAC's work on the asthma side is to provide community health workers through the Department of Healthcare Services CalAIM program, who spend a lot of time in people's homes in these communities who are either uninsured or on Medi-Cal in all 8 counties of the San Joaquin Valley, to help those families create a safe place to breathe inside their homes. Because as we always say, everyone deserves a safe place to breathe. Unfortunately, as we find out, doing more work indoors with air monitoring and outdoors, not everybody gets one. And the inequity here is pretty impressive and is something that is, to us, unconscionable. So in order to sort of solve these problems, we have to understand what's going on underneath. And so we've been doing a little work around this here and there. The way we approach these kinds of things is working with our partners in various communities. And as we'll talk about today in these 2 programs that we think are especially powerful and lay the groundwork for, as Dr. Thin mentioned a while ago, this next step up from this, where we'll be working with homes in different cities to replace their gas appliances with energy efficient electrical appliances after we've done a thorough health and economic survey and evaluating the social determinants of health that they experience every day and following them for a few years. First, though, we needed to know a little bit more. And so we have these two studies that are assessing the indoor air quality in these low-income communities of Kern and Tulare County. Now, Kern and Tulare County share two huge distinctions from most of the rest of California. Kern County holds the largest oil reserve and oil pumping and recovery facilities in the Western United States. And so those families down there are experiencing living literally in the middle of the oil and gas industry on a scale that's hard to imagine until you've seen it. Tulare County has the highest concentration of dairy farms in the nation, and the largest number of dairy cows per capita. So between the two, and actually there's quite a few dairy farms in Kern County as well. So as you can imagine, when you add in the off-road emissions from two of the three busiest interstates for the freight system in the United States, the I-5 and the 99, it's quite a soup down there. And here, where I live in Fresno County, about 100 miles from there. Our HUD Healthy Homes project is described here, working with the Berkeley Air Monitoring Group. We're looking to characterize changes, as you can see, in indoor air quality associated with home electrification. Everybody wants to know this now. We've been hearing it all morning, and there's politicians that are saying that, we're going to take away your stoves. And I'm saying, yeah, it's probably a good idea. But we can't afford to take them away from everybody. But we hope to provide them for folks who really deserve and need them and can't protect themselves otherwise from these kinds of emissions and are suffering the most from it because most of their equipment is old and inefficient. The communities that we're working with on this HUD project are DuCore, Alpaugh, and Allensworth. I would bet most of you have not heard of any of these communities. They're small rural communities in the southern south of Tulare County, characteristic of many small rural communities here in Central California. And Allensworth is probably most famous as being the first and only Black founded community in California. A retired Civil War officer moved there and decided to create a city and an economy that would support his people, and was generally successful until after he died and the whole thing kind of fell apart. But now it's a state park and museum that's happily been renovated and easy to get to and visit. I recommend you go. And these communities were part of a CPUC project in disadvantaged communities that looked at which residents would want. Would they want to choose electrification of their appliances, or would they prefer to stay on propane? And they were offered new appliances, whichever direction they took. However, as with a lot of these studies, there was no health piece of this study, no evaluation early on and long-term to determine whether or not there was a health impact from creating these kinds of changes in the home. And we've always felt that that's been a deficiency in and around energy-based studies. But we're seeing that changing now, and I'm grateful for that and thankful that people like Dr. Thin can get behind the agency and move this forward. As you can see, we're going to compare daily average indoor concentrations of PM2.5, NO2, CO2 in these homes using electric cooking and heating appliances with those using wood or propane, which is a little different and it's hard to believe, but we've still got a lot of folks down here that cook with wood because wood is cheap and we're surrounded also by almond orchards, so there's plenty of it. And then, of course, looking at the impacts of a smart PM2.5 activated low-cost air cleaner indoors, and you'll see in just a minute what I'm talking about. And especially, of course, focusing that toward the many wildfire events that we experience here in the Valley, where quite a bit of the wildfire smoke that is either north of us or adjacent to us ends up concentrating here in this lowland. Here's these communities and where they're located. It was tough to get a map here that made sense, that put up a city that many of you would be able to reference. So I encourage you to check any one of them out. You can see the I-99 running down the center and the I-5 here to the west. And you can see these communities are strung out geographically across this county. CCAC has a community steering committee as part of AB 617 that's in the Terabella area and has residents from DuCore on it. We are sharing all the information from this work with those residents and taking their stories with us as well. CCAC has also established an outdoor air monitoring network, sjvair.com, where we've cited purple air monitors and BAMs from San Joaquin County all the way down to Kern. You can go to sjvaircom.com and check that out if you like. All these residents here have access to that, and the 17 members of the San Joaquin Valley Environmental Justice Advisory Committee operate that project. As you can see, these communities are very interesting in their differences as they are in their similarities. You would think when you looked in the South Valley there, you would see a bunch of people that all look pretty much the same, mainly Latino, mainly farm workers, and mainly poor. But as you see from this census data, which is the most recent I could find, 2021, they couldn't be more different in many ways. Certainly the predominant ethnicity is Hispanic, but you will note that in DuCore, the American Indian folks make up about 1.6%, and we've got a significant Asian community and Black community in Allensworth. The incomes really are all over the place because it only takes a few people making a lot of money to skew this data. It's really hard to tell in the story of just how poor so many of the people who live in this community are, but trust me, they are. Poverty is systemic here. The majority of the people in these communities are on Medi-Cal or uninsured. And as with most communities in the San Joaquin Valley, they're young communities and tend to have a lot of children. So the equipment we're using is pretty straightforward. Many of you will recognize the good old Model 405 nanometer for NO2. And we can capture very accurate atmospheric nitrogen oxide and NO in these kitchens where we're working, in these houses, and then the PAM to kind of back that up so that we can see the PM1 and 2.5 CO and CO2.
Kevin, I just want to let you know, yeah, 1 minute.
Oh, wonderful.
Sorry.
Me too.
I know. Yeah.
So the UPass, as you can see, is pretty well known again. It's very reliable. It's a very cool system. Here's the whole setup in the average kitchen that we are working in these communities. And this is what it looks like every day. So real people, real lives, and this is just the way that it is. So, and this is our handy dandy particulate controller. As you can see, PM 2.5 monitor here, Bluetooth plug. When the level rises above 35 mics in the house, it kicks on, and very quickly, this fan setup here with this MERV 13 filter can clean the air in the house down to below the health standards. And they get to keep that, by the way. In summation, we're doing something a little different with our friends from Stanford and Riverside and University of Arizona and JPL NASA and others, outdoor and indoor sampling. Here we're setting up in homes and sealing kitchens and looking at the emissions from stoves, ovens, water heaters, and furnaces. The homes are from Bakersfield, Arbor, and Lamont. Both these projects are overseen by a community advisory board made up of members from local community-based organizations who meet regularly and review the data, and from the beginning of this project advise the researchers on what they needed to see and what they should be doing, and who recruit residents from these communities to be part of these projects. We are at 37 of the 50 total homes that we intend to sample, We have data, it's a 3 to 4 hour sampling period. Obviously, there's financial remuneration to these folks for participating and allowing us to be in their homes for that period of time. As you can see, we've got some early results for 12 of these studies. It replicates a study that was done in the Bay Area. The steady state here off is really striking us as odd in that the flow rates for CH4 are so much higher here and on the high burner, and flipped over on the low burner. We're hoping that that information will kind of flesh itself out a little bit more and make it more understandable as we get the confirmed data from the other, I want to say 25 homes that we just haven't been able to finish working up the data yet to make it, valid for us to present to you. And again, looking at these same homes and comparing to the Bay Area, you can see again that flow rates here are pretty high, and that results in, of course, problems in concentration. So because those flow rates are high, you can see the concentrations building up very quickly here. From in about a half hour's time, you can see it go from less than the EPA indoor and outdoor standard, which is much higher than the indoor standard. We're far exceeding all the standards, and you can see that both NOx, NO, and NO2 rise very, very, very quickly. In many of these homes, the stove can be on for hours. People are cooking rice, people are cooking beans. In the Hmong homes that I visited over the years, there's always a pot of rice on the stove. So almost done.
Okay, you see my smiling face.
Yeah, so as we close out here, we just wanted to let you know that residents in low-income communities are being left behind in this push for zero net energy, zero net carbon future. They need and deserve homes that are healthy and safe places to breathe. We're working to make that happen. If you want to know more about us and what we're doing, I'm told if you just put your phone on this little thing right here, it will take you to our whole world here at CCAC. So please feel free to do so, and thank you for your time today.
Thanks so much, Kevin.
For just a second. Or you have time for questions if there are any?
We'll come to it at the end, Kevin. But wanted to say thank you so much for sharing the studies and findings with us. Like I said, we'll try to revisit at the end. Very enlightening, and it's great to see the community science perspective of the studies. So thank you for that.
You're welcome.
Next, I'd like to welcome our final speaker for this panel, Zach Williams. Zach Williams, MPH, is a health educator and campaign coordinator in the Environment and Health program at Physicians for Social Responsibility. With a background in climate and health education, social services for marginalized youth, project management, and international emergency response, Zach received his Bachelor's of Science in Applied Psychology and his Master's of Public Health from New York University, where he worked for UNICEF Communication for Development as the disease outbreak intern. Please help me welcome Zach Williams. Zach, are you with us today? I don't see him on. Jeff, do you? Okay, well.
Hi. I'm so sorry, everyone. I wasn't allowed to unmute myself or start my video. I'm so sorry for interrupting you. Hi, everyone.
No, it's glad to have you.
Okay, Zach.
Hi,
Yeah,
everyone.
you should be fine. Sorry, one thing I didn't talk about. You're good to go.
Thank you so much. Sorry for that little technical difficulty, everyone. Thank you so much for having me here today. My name is Zach Williams. I am the health educator and campaign coordinator for Physicians for Social Responsibility in the national office. And if I have shared my screen correctly, you should be seeing a portion of my screen with my presentation. Is that correct? Can everyone see that?
Looks great, Zach.
Great. Thank you so much, everyone. So just as a little bit of a primer before I get going in my presentation, the bread and butter of what I do at Physicians for Social Responsibility is I educate health professionals, mainly physicians, about the human health effects of indoor fossil fuel use. Long story short, I'm the gas stove guy. I've been for the past year and a half educating health professionals, concerned citizens, elected officials about the human health effects of gas stove use and what that means in terms of building electrification for our health and also climate change. So I know today is a fact-finding symposium, particularly about indoor NO2 guidelines and how we should develop those. I have some health information and some exposure data here, but you have seen too many graphs today that are saying the same thing, so I will skip right over that. And the main focus of my presentation today is going to be environmental justice. This is the section of this training that we have received a lot of positive feedback on. So I do apologize if this feels a little bit like a lecture, but I will try my best to make it light and to make it interactive and engaging. So first and foremost, you know what NO2 does to the body. We've talked about this today. And you have also seen some data that tells about NO2 exposures when you use fossil fuel appliances in the home. And particularly, this is from the Lawrence Berkeley National Laboratory study. Dr. Brett Singer is here with us today. Dr. Singer, thank you so much for this graph. It helps illuminate really what's happening inside the homes when you use a gas stove in terms of NO2 concentration. I won't go through that right now, but I will transition right to the most vulnerable populations when it comes to indoor NO2 concentrations and its connection to environmental justice. So first and foremost, when we're talking about NO2 concentrations, children happen to be one of the most vulnerable populations when it comes to indoor fossil fuel use and ambient and indoor NO2 air pollutants. First and foremost, this is due to a myriad of reasons. Children have higher breathing rates than adults do. Children also have higher lung surface to body weight ratios and smaller bodies. So an NO2 concentration that could be safe for an adult could be harmful to a child. And lastly, children's developing immune and respiratory systems are still undergoing development, so they might not necessarily have the ability to deal with stressors in the same way that adults can. So when we use these fossil fuel appliances in our homes and the NO2 concentrations skyrocket to above what the EPA says is above a healthy standard for outdoors, let alone what in the concentration that's safe indoors, our little ones are harmed because of it. And using children as a lens, I also wanted to expand this discussion to environmental justice. So first and foremost, let's continue looking at children and use childhood asthma as the lens to look at these health disparities when it comes to an environmental justice context. So not every child is equally exposed to gas stove pollutants, mainly nitrogen dioxide, and thus the distribution of childhood asthma is skewed. This is not to say that only gas stoves cause NO2, which cause childhood asthma. NO2 is everywhere, ambient and indoor, but certainly the data that I'm about to show you from the National Center of Environmental Health and the Journal from Urban Health goes to show you that there are some significant differences in population types when it comes to childhood asthma, one of the most prominent health effects of NO2 exposure. So in a couple different categories here, first, let's talk about housing. In terms of housing, 21.8% of children living in public housing have asthma, compared to just 7.39% of children living in private residences. Next, in terms of race and ethnicity, the prevalence of asthma in Puerto Rican children is almost twice that of white children, and the prevalence of asthma in Black children is more than twice that than white children. And lastly, looking at income level, 11.8% of children living below the poverty level deal with asthma, compared to just 5.9% of children at 450% or higher of the federal poverty level. And this is national data, by the way, not California specific, but this is all across the nation. So living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, one of the most prominent health effects of nitrogen dioxide exposure. And why is this? I'm going to talk a little bit about a history right now, so walk with me for a moment and stay with me. So to fully understand why being a person of color and of low socioeconomic status in the United States puts you at higher risk for respiratory illness, we have to look back at our history. First and foremost, federal housing and transportation policies essentially codified racism into the economic and geographic development of the United States in the mid-20th century. First and foremost, the Federal Housing Act of 1949 authorized the demolition of Black neighborhoods. And next, the Federal Aid Highway Act of 1956 authorized the demolition of urban neighborhoods that were labeled as urban slums and replaced them with the nascent interstate highway system. So this not only severed communities, most often Black and Hispanic communities, but also constructed long-term polluting transportation infrastructure next to, near, or simply through communities of color. Our previous presenter just talked about all of those interstate freights, those freight lines going through the communities in the San Joaquin Valley. It's a similar story to that. These long-term transportation infrastructures were put in next to or near communities of color because they did not have the political or economic capital to prevent their construction. Secondly, although it's outlawed today, many majority Black and Hispanic neighborhoods are still reeling from the effects of redlining. A little bit of a definition here. Redlining is a homeowner's loan corporation categorization strategy and policy where some neighborhoods were labeled as high risk, whose residents should not be given access to mortgages. Their neighborhoods were outlined in red, hence the name redlining. However, now redlining refers to lending discrimination on the lending discrimination that bases credit decisions on the location of a property to the exclusion of characteristics of the borrower or the property. A little bit more history here. In the post-Civil War era of Reconstruction, through the first half of the 20th century, the Great Migration took place, where millions of Black Americans moved from the South to northern cities and California for economic opportunity and to escape the horrors of the Jim Crow South. In response to this influx of Black residences, many cities across America used redlining as a policy and a housing practice to keep cities segregated and to keep Black folks out of white neighborhoods. Redlining prevented investments in infrastructure, green space, public transportation, business development, and all other aspects of city planning that make for successful, prosperous, and healthy neighborhoods. Because banks refused to give loans to Black Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systemically address these issues. Now, this is not just a race and ethnicity issue, this is also a socioeconomic issue. So let's dive a little bit deeper into classism, environmental classism, and the reasons why poor folks, whether you are Black, white, Latino, or any other race, are dealing with increased levels of air pollution. And specifically when it comes to gas stove pollution, which one of the primary pollutants due to the incombustion of fossil fuels is nitrogen dioxide. Why do poor folks get impacted by NO2 more than folks who aren't poor? First and foremost, smaller unit sizes. It's important to remember that from Dr. Singer's study, from the data, the slide that I skipped right through because we've heard enough about that today, but in homes that are less than 1,000 square feet, the ambient air standard for NO2 is exceeded 100% of the time when you cook on a gas stove without ventilation in a home that's less than 1,000 square feet. And poor folks tend to live in homes that are smaller, small. Along with smaller unit sizes, there are also usually more people per home than higher income households. So not only are more people using the stove to cook throughout the day, but also more folks are breathing in the pollution that is produced from that kitchen appliance. This also goes for gas furnaces, gas water heaters, gas fireplaces. Any appliance that uses fossil fuel is going to produce nitrogen dioxide. There are more people in low-income households than in higher income households. Next, low-income families are also more likely to live in older homes and have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted in years and may even have a pilot light still, and they may have inadequate ventilation over the stove. Having a cooking appliance with a pilot light means there is methane burning constantly in your home. It's great and convenient when you want ramen noodles at 2 a.m., but it also means that there is NO2 being pumped into the home 24/7. Most gas stoves nowadays use the sparker mechanisms, the click, click, click when you turn on your burner, but older homes and older appliances may still have a pilot light. Next, low-income homes are also more likely to use stoves and ovens for heat. This is probably more so for our NorCal folks than our SoCal folks, but homes with inadequate ventilation, poor landlord management, and poor insulation make families in these situations turn to the most readily available source for heat for relief, which is typically the kitchen oven, which does the job. It heats the home, it provides relief from the cold while pumping the home full of NO2. Next, low-income homes are also more likely to have higher exposure to outdoor pollution. LaDonna, thank you so much for your comment before from the previous panel, where because of the concept of NIMBYism, not in my backyard, often wealthier, wider neighborhoods have the political and economic capital to say, I don't want that wastewater treatment plant in my neighborhood. I don't want that fracking site in my neighborhood. I don't want that food distribution site that runs on diesel trucks in my neighborhood, until it eventually reaches the low-income community who doesn't have the political or economic capital to say no, and then they get stuck with higher exposure to outdoor air pollution. Commonly also NO2 is part of that ambient air pollution. And lastly, low-income folks are also more likely to already have a greater asthma burden, so they feel the effects of gas stove pollution, the majority of which is NO2, more so than folks who don't already have a greater asthma burden. So that's all the depressing information about why using a gas stove and why NO2 affects Black, Latine, and other people of color and low economic status folks more so than wealthier, wider folks. But you never present a problem without a solution. So before I get to what, from the community-based organization perspective, what can happen for the NO2 indoor guidelines, I would be remiss if I did not at least give y'all some tips and tricks to what to do in your own kitchen to reduce the amount of NO2 that you are being exposed to. First and foremost, this is the solutions for gas stove pollution in general. So carbon monoxide is also included in that. I'll skip over that right now, but if you have it and it's available, run your exhaust hood while you cook. I know it's loud, I know it's annoying, I know it's cacophonous, but it is also making sure that you are not being exposed to really intense levels of nitrogen dioxide when you just want to fry an egg in the morning to have for breakfast. I will couple this with the fourth one down here, which is cook on the back burners. You should be cooking on the back burners because the pollutants are much more likely to get sucked up into the exhaust hood rather than cooking on the front burners. And open a window while you cook. It's the $3.99 solution to get air pollutants out of your home. However, if you live in a place where there's higher ambient air pollution, I understand why you wouldn't want to do that. The other solutions are more so adaptation strategies, mitigation strategies, use electric appliances. But now let's actually go to what we can do for environmental justice and guideline development. What can we do? So
that's 1 minute warning, Zach.
Thank you so much.
Okay,
I will speak incredibly fast.
All right.
So this is, I have to admit, I got most of this information from our wonderful chapter in LA, PSR LA, who has done a lot of work in environmental justice in the building decarbonization space. So their local and statewide partners have advocated for policy development, a policy development approach through a co-design process. So communities and community-based organizations should be engaged early to co-develop policies that are impacting their community. Second is the need for holistic home improvements that can improve indoor health of homes. I know this is specifically about NO2 today, but it is also incredibly important to know that NOx is a cumulative pollutant that impacts EJ communities, and programs should definitely be formulated and made to improve the indoor and outdoor air quality in general and not just focus on NO2. And lastly, it's important to have a collaborative co-development of air quality guidelines because certain intersections that can be illuminated may have been missed without EJ Group's involvement. For example, although CARB is not a housing justice group, it would be crucial to keep in mind that any guideline that can be used to change local or statewide legal air quality standards will be used to change the physical environment of residential buildings. Updates to these buildings need to make sure to ensure that they meet the air quality standards should not mean higher rents and forced displacement of the people who have been exposed to the worst levels of NO2 for their entire lives before they can reap the benefits of cleaner air. Additionally, the costs of decarbonization and improving building air quality shouldn't be passed on to the tenants, and corporate landlords should not be allowed to receive public assistance for the decarbonization of their buildings. Essentially, it's important to remember that people including poor people and those who are at high risk of homelessness, live in buildings. Intentional and early engagement of boots on the ground environmental justice and housing justice, community-based organizations, and the development of these policies and guidelines can help make sure that last mile populations and environmental justice communities are not left behind in the movement to make buildings healthier, habitable, energy efficient, all electric, and climate resilient. Thank you so much. And this panel will take questions now.
Thanks so much, Zach. Thanks for the tips and tricks, and they were wonderful, and really appreciate the ending call to action. So as Zach was saying, we're not going to transition to a Q&A for this panel. Just friendly reminder, if you have any questions, please feel free to drop them in the Q&A. In the meantime, I'm going to ask a quick question. So this one is for Annie. So Annie, I'm incredibly happy to hear that the participants had a great experience with the pilot project. My question to you is, how were the emissions reductions calculated to the participants? So I'll let you answer that one, then I have a follow-up as well.
I'm not entirely sure I understand the question, except that we put a report together that summarized our like our methods and the results and kind of all of the pieces that went into our pilot. And we did do a presentation for all of the participants in advance of releasing it publicly to talk to them about, you know, what we had been doing in their homes, even though we had been really educating them throughout the entire process, but to kind of give them the end results of, you know, some of the like hard numbers of in terms of emissions reductions that we were able to measure.
Yes, that was it. Thank you. Just how were the findings communicated to them? Also, I didn't quite capture where all the households, did they keep their older stoves, or, and if they did, if any of them did you see the participants change their daily practices? So the way that they, like opening windows, for example.
So I'm happy to report that all of the households that participated in our pilot received an induction stove. They were given the option to take back their gas stove at the end of the study, and nobody took us up on that offer, which was encouraging to see. We did share some similar tips and tricks that Zach shared, because the reality is that this building is 96 units and we only installed induction stoves in 20 households. And so, you know, many people have neighbors, friends in the building that heard about our pilot a little bit later, and, you know, were interested and invested in the results, and interested also in how they could protect their family. And in, you know, the wait time that it's going to take to decarbonize this building in its entirety, which is in the works, but is going to be a long process. We did want to make sure that people, you know, had some information to protect themselves and take actions in their own ways.
Thank you, Annie. And on that same note about the information, so this is a question for all panelists. What are some of the strategies to help empower community members to mitigate indoor air quality in environmental justice households?
I'll go first, I guess. There's a bit of a toss-up in the building electrification space right now, because it's focused a lot on personal responsibility. You have to open your window, you have to use your exhaust hood, you have to replace your gas stove, you have to start using induction cooktops, like a countertop plug-in, plug-out induction burner. So those are some strategies if like your little one is really having trouble breathing at night and you want to just try to reduce the amount of air pollution that you're being exposed to. Those are like adaptation strategies. The mitigation strategies of, you know, not turning on your gas stove, replacing it entirely with an electric stove, those are some things that will at least get to the root cause of fossil fuel pollution, NO2 concentration. But also, the personal responsibility thing is a little tough, because if you are someone who has 4 kids and is struggling to pay rent and put food on the table, and someone comes and tells you your gas stove is killing your kids, go buy an $8,000 induction stove, you're going to prioritize food and housing and not necessarily go out and replace your appliance because it's not financially feasible. So luckily, there is a lot of money in the Inflation Reduction Act for getting tax rebates, or if you are below the average income of your zip code, you can get direct point of sale discounts on induction cooktops, electric water heaters, essentially all of the electric replacements for fossil fuel appliances. But if you rent, if you don't have control over your appliances, you then have to convince your landlord to take the tax rebate and update the appliances in your kitchen, which I don't know if anyone has asked their landlord anything ever, but that is incredibly hard to do and convince someone to replace an appliance. So I would say there's the personal responsibility piece to reduce your exposure to NO2, but really what needs to happen is some larger scale, either statewide or more federal funding to provide cost-free building rehabilitation programs for folks who live in these older homes, who possibly even may rent an older home and just do not have the financial ability to replace an entire fossil fuel appliance with a gas stove appliance.
So if I can kick in here for a minute on this. So, I mean, the idea of this personal responsibility thing is like the bootstrap thing. It's ludicrous on its face. And again, it goes to capacity. However, there are programs running right now, happily, in the state of California. I mentioned briefly Calium earlier. For the first time ever, we're able to, and CCAC is doing this work across the valley, go into people's homes, do an in-home environmental health, EPA environmental health evaluation, and that we can create some pretty dramatic changes in people's homes, up and to and including fixing leaks in walls and addressing appliances that may be substandard or have some mechanical problems. We have the ability now to get those things fixed for people. And we've actually been doing this a long time on soft money, but finally got Department of Healthcare Services and the governor to budget this. So if in that household there is a child or an adult with asthma, we have an opportunity there, and we're taking advantage of that opportunity in the study that Dr. Thin mentioned earlier. But you know, as we do this, it takes about 2.5 hours to do that kind of evaluation of a home, room to room, looking at relative humidity in the room, gas sampling. It's quite challenging. There's a limited amount people can take on personally. The way CCAC works is we help them do what they can in their home and then provide them tools in the home that can make that easier for them, make it more likely to happen, to create that safe place to breathe. And then keep in mind, it's not just NO2. There's a variety of sources inside any home that are potentially dangerous. And then you've got the outside sources. So we don't expect that the average person can take time out of their busy life to advocate for clean air in their neighborhoods, in their homes. And so that's a role that we also take on with our other partners. So it really needs to be this sort of combined approach of communities working together to create both clean air outdoors and indoors. And it's going to take a lot of work. Nobody wants to face it. The best solution is that we go in, we invest what we need to in these homes to decarbonize them. We put on the new roof if it's needed and a new electrical service. We throw the solar and battery on the roof. You know, we make the house energy efficiency and seal it up. The whole cost for something like that, Max Wees figured this out over in LBNL. If you took advantage of all the programs, the incentive programs that are in California right now, it could cost you less than $100,000 to do that to the average home. Match that against the cost of tearing that home down and building a new home, which is not going to happen, by the way. So as we pitch this idea and looking for funding for pilots from the agency, the comment I often get is, do you realize how many of those there are? How many of those homes? I say, yeah, so I guess we better get moving, right? So, I mean, you got to start somewhere, sometime. Otherwise, we leave all these folks behind. And, you know, is that what we really want to do? Because nothing's going to change. Landlords aren't suddenly going to get a lot of money that they take in rent and reinvest them in these homes and decarbonize them. So that's not going to happen. But I have found that not one landlord we've approached when we're going to do something to fix their, as I call it, their investment for free, has said, no, don't do that. You know, don't fix that pipe. Don't, you know, don't change that out, that water. No, don't do that. No. So it can be done. It is being done, and it should be done, and we must do it.
Thank you all. So we did have one question come in. If you could share programs for people to get assistance changing their gas to electric stoves. Zach, I believe that's the link that you posted, so I will respond to that in the Q&A. Last thing I will end with is just any general advice on how it is that practices that you can share to help share resources for community members. So just like where to go to if they want to look for other programs, how should they take action on that?
In like a minute or less, because we do have to move on.
So the best place that I know to go for these kinds of things is to your utility, to their website, and see what they've got. SCE has better programs than PG&E right now for appliances. Our understanding is there'll be more and more money for actually changing out some of these gas appliances for energy efficient electric appliances. PG&E hasn't quite made that leap, but we hope we see all the IOUs go there. It's a little more difficult if you live in a municipal, though DWP, I understand, also has some really great programs. So that's the primary place that I know to look at in this particular arena. There may be others, but I don't know what they are.
Very helpful. Thank you so much.
I'll
Okay,
just say, I'm so sorry. I'll just say very quickly here, I'm going to drop a link in the chat. This is Rewiring America's IRA savings calculator. You can put in your zip code, your homeowner status, your income, your tax filing, your household size, all of that. And it'll essentially spit out how much money you can get from the federal government to electrify your home if you own it. So that is another way to find out some steps to take to electrify your home.
Awesome. Thank you both. Thank you so much for sharing all that. And thank you to our incredible panelists for such a fruitful discussion. I'd now like to welcome Jeff Williams to help guide us through our last panel regarding research findings on children's health and nitrogen dioxide.
There we go. I got to be on. It's for you guys to see me. Thank you very much, Victoria. Appreciate that. So we're going to go now to our last panel. We have two distinguished speakers. Everyone's been distinguished. It's always a pleasure to introduce Brett Singer. Brett Singer is a senior scientist and the head of the Sustainable Energy and Environment Divisions at the Department of Lawrence Berkeley National Laboratory. He heads research on air pollutant sources, transport, and transformation processes and human exposures in the built environment, with a special focus on the use of engineering and administrative controls to mitigate exposure and harm. And I'll also go ahead and introduce for this panel Stephanie Holm. Dr. Stephanie Holm received her medical degree in 2011 from the University of Pittsburgh. She's board certified in both pediatrics and environmental occupational medicine. She trained at Children's Hospital and Research Center in Oakland and the University of California, San Francisco, respectively. Dr. Holm completed an MPH in 2017 and a PhD in 2021 in epidemiology at UC Berkeley. Her ongoing research activities include work on cooking-related indoor air pollution and associated health effects in children. And with that, I'm going to turn it over to Dr. Singer, and Brett, you can start your presentation.
Great. Okay, continue. And let's go to PowerPoint, share, and let's get to there. Okay, great. So you see the presentation, hopefully?
That looks great.
Fabulous. I just got to clear some other stuff off my screen. Okay, there we go. Well, I guess we'll go right for it. So this is, let me jump right in. We'll actually go one step back here if I can. Let's see there we go. I'm going to present research today that was funded by a number of agencies. I like to point this out because none of this work happens in a vacuum. So this is all of those who pay taxes or ratepayers in California support this. We got funding for the work shown here from the Energy Commission, Building America program for the DOE, US EPA and HUD. And we've also been fortunate to have research funding from ARB for other related research. And of course, I don't do any of this alone. So there's many colleagues, including down in the corner, Sunny Liu from Health Canada, who's been an excellent collaborator. A lot has been already spoken about, so I'm going to go to the key points just in words, and then some of the stuff I'm going to go through very quickly. I'll share the slides, so there's more in these slides that I'm going to go through, but I wanted to kind of document what's here. So the main source of NO2 in California non-smoking homes, so these homes without, obviously if they're smoking, that's a big source of NO2. If you're cooking with wood, as Kevin mentioned, like that's going to be a big source, but wood cooking is uncommon. Smoking, unfortunately, is still too common. But outside of those, the main sources are either outdoor air or gas cooking burners. Other gas appliances, and this is a point I think maybe people on this call know this well, but many people don't. Other gas appliances are actually vented so that they release their combustion products directly to the outdoors. And there's quite a lot of infrastructure to make sure that happens. There are these other appliances called vent-free gas heaters and hearth products, which are unfortunately legal and sold and used in other states. They are not legal for sale in California. So that was a good job, us. Using gas cooking burners to cook a single meal without also using a venting range hood or a lot of vents in natural ventilation, opening windows, et cetera, can result in nitrogen dioxide concentrations above health-based thresholds for 1 hour exposures, and cooking multiple meals in a day can result in NO2 above the Canadian residential IQ guideline level of 10.5 parts per billion. The likelihood of exceeding a threshold increases with the amount of cooking, and it also increases in smaller homes. These points have been made very well by my co-presenters previously. Effective use of a venting range would greatly reduce the likelihood of exceeding either of these, even when burners are used to cook multiple meals in a day. I'm going to focus more on the range hood use because a lot of the other stuff has been covered, but I'll just quickly mention outdoor air. The key point is that it's spatially heterogeneous. So it does depend on where you are. This was a nice satellite-based study. And if you look on the right, NO2 concentration, average concentrations, importantly, the black and the red are the difference between just like the averaging across the area versus averaging where the people are. So that sometimes that's a little different. And you see that across the different counties, it goes from anywhere from low ppb levels, 2-3 ppb, up to 10 to 16, depending on how you're averaging. So it's quite a lot of variability. And this is another complicated plot, okay, but I want you to focus on the right side of the plot. And what they did is they said, okay, let's try to figure out like what the kind of building is where we're looking from the satellite and break it up by building type. And you see over on the right that apartments, and especially high-rise apartments, are generally in these like more urbanized, densely populated areas. So they on average have higher NO2 from outside. And then other presenters also brought up the very important points about environmental justice communities, where you can also have higher NO2 from buses, trucks, rail operations, et cetera. So NO2 emissions from burners, as somebody noted, it's not just NO2 that's produced from burners or from cooking. So with that gas flame, if everything goes well, you're producing carbon dioxide and water vapor. But I think what people don't always appreciate is the nitrogen oxides are not necessarily an indication that anything is wrong with combustion. Those are produced from good combustion. Some of the other stuff like carbon monoxide, formaldehyde, ultrafine particles, those are sort of imperfections in the combustion. And then other cooking can also produce. And on the right side, you can also, through the cooking, produce more ultrafine particles, acrolein, PAHs, PM2.5, et cetera. So it's not just the gas burners. I was asked to talk about sort of recent research, but I always like to point out, like, this is not a new problem. It's not like we just discovered this, when I started doing research in the mid 2000s, right? I did that research because I looked back and said, wow, this has not been resolved. So let's make sure and check to see if it's still happening. And of course, it is still happening, but this is work from Jack Spengler of Harvard measurements back in the early 80s. The paper was 1983. And there's a couple of interesting features. So on the right-hand side there, you're looking at the results from a couple of different groups. So up on the top, that's natural gas and liquefied propane. So importantly, when we say gas, propane stoves produce basically the same pollutants that a gas stove produces. The kitchen is higher than the bedroom. In the fall and winter, it's higher than in other seasons. That's because windows are generally closed. You also have more cooking. Interestingly, or importantly, in the homes with electric cooking, concentrations are lower than outdoors. So what happens is nitrogen dioxide actually reacts with surfaces and materials. So if you have no indoor sources, your NO2 inside will be lower than it is outside. This point has been made, so I won't belabor it here. This is data from some very high quality measurements in a home in New York. And just that when you have those gas cooking burners, that source leads to the very high short-term concentrations. You don't get those from outdoors, the high acute concentrations. And you also don't get very high concentrations that commonly exceed those guideline levels that we've been talking about. This is work that I think Maninder maybe mentioned. This is from one of the studies we did with CEC funding. And basically, what you're looking at, this is we tried to take out the outdoor parts. So this is just the stuff that was contributed from indoors. And actually, if I go back two, you see concentrations are much higher in the kitchen than in the bedroom. I think, I can't remember if I mentioned that, but anyway, so this is looking at the bedroom. So this is not taking the worst case of what happened in the kitchen. This is kind of like all around the house. And what you see is that it's not the other gas appliances. It really is the gas cooking that's causing the elevated concentrations. And then this one just shows that as people said that they cooked more with electric burners, it didn't change the nitrogen dioxide concentration in their homes, but as they cooked more with their gas burners, their concentrations and exposures did increase. This was the modeling study that was discussed. Then that you can look those numbers. Don't take too seriously the precise numbers. The idea is I can't say that, oh, for sure 55 to 70% of homes that cook with gas regularly in Southern California during the winter are going to have an exceedance of this 1 hour threshold. The point is that this reinforces that this is not an odd or an extreme condition. That this shows that if you're cooking with gas and not using a range hood, and your windows are closed, you're going to commonly exceed. And I think Scott pointed out that the smaller homes, right? Definitely, it's a bigger problem in smaller homes, but it happens also in medium-sized homes, less so in the really big homes, because if you have a 3,500 or 4,000 square foot house, right, you have a lot of dilution volume. But if you have a normal, 2,000 or 1,500 or 1,000 square foot house or apartment, it's a real issue. So that was the modeling. We said, okay, let's go out into the field. Again, this study was referred to as a 2017 paper, just so you can see kind of what the equipment looked like. We brought laboratory grade monitors into the homes. We measured in the kitchen and in another place in the, distant from the kitchen. You saw this picture before. And you saw that, you get higher concentrations in the kitchen. The blue here, by the way, is the bedroom. So there are big differences between what's happening in the kitchen, in that room that, is semi-enclosed, and it looks a lot different if the kitchen is semi-enclosed versus, let's say, a big open floor plan. Interestingly, this is from a home that actually had continuous mechanical ventilation. So that wasn't good enough. You really do need to use the range hood. And let me just push on. Again, I'm not going to talk about this, but there was some really nice work done by the Stanford group looking at emission rates from gas burners. And again, the nice thing is it shows that it's not just the oddball couple of devices. These are very common. You see consistent results across many, many devices. So it's a common issue. So the controls, there's a number of different options for kitchen ventilation. The range hood and over the range microwave that vents. Now they don't all vent. Sometimes they recirculate air back into the kitchen. So it's important to confirm that they're actually doing that. You could have a ceiling exhaust fan, a wall exhaust fan, downdraft. Opening a window is not as good, but it can be effective. And then on the range hoods, we talked about this metric called capture efficiency, which is in that little cartoon over on the left. Basically, it's just what fraction of whatever you're producing at the burner gets sucked up into the range hood and pushed outside, so you don't have to breathe it inside. And obviously, we want that to be as close to 100% as possible. And we've done a lot of work looking at this. So this was some results from a laboratory study. We looked at 7 different hoods of different qualities. And somebody mentioned, or maybe a couple people mentioned, cooking on the back burners. What you're looking at on the top is data from back burners. On the bottom is from front burners. And it's, as you increase the airflow, generally your capture efficiency increases. But for the same airflow in the same hood, it's almost always way better on the back burner than the front burner. So that is something that, like, if you have a venting range hood, number 1, use it. Number 2, cook on the back burners makes a big difference. Okay. Then we, in that same field study where we went out to 9 homes, I guess 1, 2, 3, 4, 5, 6 of the homes, I have to always remind myself, had venting range hoods or microwaves. So we just took a look and saw, okay, when we operate the microwaves or the range hoods to vent, how much do we reduce concentrations? So that's what you're looking at here. So there's, again, 1, 2, 3, 4, 5, 6, 7, I guess all 9 of the homes. I don't know why we have data from 9 homes. I got to go back to this, but basically 6 of them had venting range hoods. And what we looked at, I guess maybe that's why. Anyway, so what you look at though is that the effectiveness of these devices that were, as installed in the homes varied quite a lot. You see, house 1 had a really good range hood. It covered all the burners. No matter what condition you did, it moved a lot of air. It really reduced the concentrations by quite a lot. Whereas house 6, the device was not nearly as good and only reduced it by, in the order of 5 to 40%. So there is a lot of variability in how effective these are. Some of the challenges, people don't use the range hoods. This is from a survey we did, a new home study, and 2,400 homes were built between, I think, 2003, 2010. And what you're looking at is, how likely they are. That yellow line is like they use it at all. The red and blue is using it a lot. Interestingly, people who had devices that exhausted to the outdoors said that they use them more frequently. And they also said this study, and there's another nice study where it was a population representative survey in Canada, that people actually pick up when the range hoods are working well. So ranges with more speeds, better flow, quieter, better coverage. People use those more. So improving this equipment actually has a big benefit.
You have about a minute and a half left, Brad.
Perfect, right on time. So
Perfect.
we also looked at whether people use the range hoods, and what we found is essentially that as they cooked more, they were more likely to use the range hoods. So that's what those plots on the left show, that if they're cooking for longer periods or more burners, they're more likely to use the range hoods. But still, most of the time, people did not use the range hoods when they cooked. So some work is needed there. This is the point. Why do people not use the range hoods? Mostly because they say it's not needed. Okay, but if it doesn't work is one of the issues. And again, people who have ranges that don't vent actually are pretty good at detecting that. So we thought that was kind of interesting. And then this is just some notes. Venting range hoods can effectively capture and remove burner pollutants. Very importantly, they also remove all those other pollutants you get released while cooking. So that's one of the points, is that yes, there's benefit of replacing the gas range with an electric, but you still want to have kitchen ventilation because the cooking also produces a lot of pollutants. And I think that that's it. So there's a bunch of references. We'll share the presentation, and I'd like to stop now and turn it over to Stephanie to tell you about health effects. I just got to stop.
Excellent. Thank you, Brett. Man, you are right on time. Okay. Our next speaker is Dr. Stephanie Holm. Welcome, Stephanie. We look forward to hearing what you have for us today.
Thank you so much, Brett. If you can stop your screen share, I'll be able to do mine. I will apologize and say I've got a bit of a raspy voice today. So
sorry about that. And I thought I had stopped it. Let's see.
You're good now. We'll make this a little quick. I have the advantage of getting to go after everybody else has done a lovely 4-hour introduction for me. So shout out to all of our prior speakers. Really appreciate all of that. I'm going to be doing just sort of a quick update. Obviously, can't cover all of the research on NO2 and health since CARB blasted indoor air guidelines in 2005, but I'm going to give you sort of some perspective on relevant things to think about as we move forward. I have no financial relationships to disclose. I am lucky enough to get government funding or employment from a variety of sources. And so my views are my own and not official stances of any of the folks that fund or employ me. All right, so I'm going to just briefly touch on some of the existing guidelines and standards, which you've heard quite a bit about already from other folks. And then since we know a lot about the cardiorespiratory effects, you've actually heard about those from lots of other people today, I thought I'd mention some of the other health effects that we have some evidence for from ambient air pollution, and then talk about some of the recent literature on indoor NO2, what some of the sort of interesting questions are still in that work. And then just briefly mention some of my own work that I've been doing. So you've heard quite a bit about this already, but indoor air quality is really determined by a combination of the ambient pollutants as well as things that are emitted indoors. And so, both of those things are relevant. I think it's certainly a reason that it's worth, using the wealth of information that we have from the literature on ambient NO2, but certainly things are different in some ways in the things that are emitted indoors and therefore your indoor exposures. And so also, of course, it's really important to consider the literature that we have from indoor situations as well. All right, Mei Wu actually put up a really similar nice table to this earlier, where she sort of laid out, what the previous either guideline levels or standards or various things were from different groups and when those came from. So, we've got the last CARB indoor air ones that were released in 2005.
Looks like we lost Stephanie. Has anyone else lost her? There you are. Okay. Sorry, Stephanie, you cut out for a second. It's okay. Go ahead.
Oh, I'm so sorry.
No, it's okay.
All right. So I'm not quite sure what you missed, but I have a table here similar to some things that Mei Wu put up earlier and other folks. But I think the key point that I was trying to illustrate with this list of, what the various guidance and standard levels are, is that many of them have been based on respiratory effects, right? So the CARB guidance from back in 2005 talks about protecting from lung irritation and asthma. The recent Health Canada information talks a lot about lung function changes and symptoms in kids with asthma, some other effects as well. US EPA's most recent integrated science assessment, describes respiratory effects as ones that are causal for short-term effects and likely causal for long-term effects. And then the most recent WHO, one of the biggest things that it used for making the NO2 guidance was effects on mortality, which, I like to think of as sort of a crude measure in the sense that when we get to the point that we're looking at mortality, there's been a whole lot of, disability and illness that's happened first. But the reason I point all this out is that it's pretty well established that there are substantial cardiorespiratory effects related to NO2 exposures. And so I'm mostly actually going to then talk about other things, since I don't feel like you need to hear that again and again. I do want to mention, and I think one of our earlier speakers that talked about the WHO talked about this, that they had commissioned some studies that happened as part of that set of guideline revisions, and some really fascinating studies. So I thought it was worth, as we're talking about the recent literature, just mentioning some more details about these. So there's a Health Effects Institute report looking at chronic low exposures to NO2 and mortality. They funded a couple of different cohorts. I think 2 of the 3 covered NO2 as well as other pollutants. And this is a graph from the ESCAPE cohort in Europe. they combined a number of different sort of data sources and cohorts that already exist. So covering a total population of about 30 million people. And these folks are actually really exposed to quite low levels of NO2. So you can see they've marked off 40 and below, and all the cohorts, the median exposure level was before that. One of the neat things they did was they then looked at the exposure response curve, looking at different concentrations of NO2, again, ambient NO2, what's the effect on mortality? And just to sort of tie it to those guidance levels that we were mentioning, just to sort of give you a sense, since units are different for some of them and all of that, that most recent WHO guidance level is down here at 10. The Canadian one is here at 40. And relative to this chart where you're seeing there's increasing risk of mortality as you go along, related to NO2 concentrations here, the current EPA ambient guidance, US EPA, and the CARB guidance level, both actually the indoor and outdoor, are like off this chart, right? So certainly substantial evidence of effect well below the levels that we're currently using. Similar work done in the US, but actually, I believe this is the largest ever study looking at air pollution and mortality. This used data from 60 million Medicare recipients over a 16-year period. And similarly, they found that there were pretty consistent findings across multiple statistical approaches with increasing risk of mortality, even at the very low levels of NO2 exposure. This goes through a slightly broader range than that European study does. So if I label those same points for you, you can see that this leftmost bit is sort of the equivalent of what we saw on the graph from the European study, very similar shape to the curve, may flatten out a little bit, but then go up, but certainly with an overall increasing pattern of mortality as the NO2 exposure goes up. Again, as I said, from quite a very low level. All right, so then just briefly touching on non-respiratory and cardiovascular outcomes, there are a number of things that have gotten quite a lot of work in recent years, and I, in my 15 minutes, I really can't give adequate coverage to all of these, but I thought I would just at least mention. So these are all areas that have had enough work that actually systematic reviews have been published in the last couple of years that have found effects of differing sizes, but health effects related to ambient NO2 exposure and a particular effect. So, looking in sort of the neuropsychiatric realm, there seem to be effects on depression, possibly related to both short and long-term NO2 exposure. Risk of various developmental issues. So exposure during pregnancy is associated with risk of autism later in childhood, some risk of dementia related to NO2 exposure. That's sort of all neuropsychiatric stuff under the allergy category. Also some relationships seen there with sort of allergy, runny nose kinds of symptoms. Metabolic effects, that includes things like diabetes, increases in diastolic blood pressure, increases in childhood obesity. And then a smattering of other things as well. So I kind of gave you a sampling here, but there's pretty strong evidence that there may be some NO2 effects on chronic kidney disease. Looks like there may be an NO2 effect on conjunctivitis, that's pink eye, and increased risk of childhood leukemia, especially with pregnancy exposure. As I said, sort of a laundry list, but what I wanted to make the point here is that, we've got really strong mortality and respiratory, cardiorespiratory kind of evidence for NO2 health effects. But there's this growing field of other health effects that I think are worth keeping an eye on, even if they haven't quite yet met the threshold for regulatory action based on those endpoints. Sorry. Moving to some recent work specifically on indoor NO2 and asthma. It's well supported that indoor NO2 is associated with the development of asthma in kids. Certainly, more research is useful, particularly from a regulatory standpoint. The more we can solidify those things, I think it's very helpful. But at this point, there's a substantial literature showing that NO2 can increase the risk of asthma. And some interesting stuff recently includes, so there was this paper that looked at NO2 levels in kids with asthma. So these are already, kids already diagnosed with asthma, but in their classrooms, and showed that down to 8 parts per billion of NO2, the kids actually had decreasing FEV1 FVC ratio. That's a kind of lung function testing parameter. Basically that their obstruction, the effect of the asthma on their lungs, was worse the more NO2 you had, all the way down to about 8 parts per billion. I think that's really powerful, just thinking about, those low levels and classroom effects, right? Anytime we can change something in a classroom, we have the potential to help 20, 25, someplace in California, 30 kids all at once, right? And so that's really powerful. There's also a recent study that tried to really estimate the disease burden of childhood asthma specifically due to indoor sources compared to outdoor, and attributes a substantial amount there as well. And then similarly in adults, I'm a pediatrician, so I often focus on kids, but adults also have been shown to have higher symptoms, higher asthma symptoms with high home and NO2. Okay, and then some sort of interesting early, stuff and gaps. I think Brett mentioned, Dr. Singer mentioned one of the points about that the exposure pattern is different indoors, right? That you tend to have more of these high spikes compared to outdoor ambient measurements. And one of the things that's been really fascinating for me as I've gotten to work in this space in the last decade or so is that, as we have increases in real-time monitoring, we can see those exposure profiles indoors much better than we used to be able to, right? Historically, it's often been that we're using time integrated samples and really just getting an average over time. But more and more, yep, I'm working, Jeff, I'll be done soon.
Okay. 2 minutes.
More and more, we're able to actually see what that exposure curve looks like. And so there was a pilot study that just was published last year, doing sort of a early simplistic analysis, but looking at, the NO2 spikes as opposed to just average levels. And I think that's really an area that we should watch, that I think, a lot could happen in that space, looking at what are the health relevant exposures and what does that look like in an indoor space where there's less mixing, and that pattern then ends up being quite different. Another thing that I think is really fascinating, actually, in the last just couple of months, a couple of papers have been published looking at interventions specifically on NO2, and then trying to tease that apart from indoor NO2, and trying to tease that apart from intervening on other pollutants. As we all know, it's not like any of us are exposed to these pollutants in isolation. We're basically always exposed to a mixture. And so we're having health effects related to that whole milieu. And it's interesting to be able to figure out, what components really require intervention, which pieces are going to have substantial effects. So there's a study that recently looked at NO2 filtration versus PM2.5 in kids with asthma, and a similar one that did one in adults with COPD. And both found effects related to the PM2.5 and not the NO2. As I said, this is kind of early stuff. These are the first couple studies that I think have done this particularly well. But I do think it raises the issue that it's, worth thinking through as we consider standards and guidelines. How do we do these things in relationship to other contents of a mixture? Because as I said, we're not ever exposed to any one particular thing. And then partially just because I'm a pediatrician, anytime there are effects on learning and neurodevelopment, I think that's particularly impactful, right? As soon as you tell a parent that something's going to affect how well their kid can do at school, that's really scary. And there's increasing evidence there related to NO2 effects. I will wrap up momentarily and just say that, there's been a lot of attention related to cooking related pollution so far this year. And I think that's certainly justified. A lot of the other speakers made that point well. I'm excited to have some upcoming work on this. I know Maninder Thind mentioned earlier, and Dr. Singer and I have a study coming up that'll be diving into some more of this stuff. So really looking forward to that work. I have a bunch of folks that I work with. The PACU has a bunch of resources. We actually have a video and infographic about how to have your air be cleaner while you're cooking. So that's available on our webpage there if you want to grab that. I'll put the link in the chat too.
Excellent. Thank you so much, Stephanie. That was great. Okay, I'm gonna go ahead and just combine our last session. We're gonna have an open Q&A, and I'm gonna prioritize questions, of course, for our last two panelists. I'm gonna start off with one that came in on the chat that I think is probably looks like for Brett. How much does, and this was asked by Sakura Carter, I hope I pronounced that right. How does mechanical ventilation compare to natural ventilation? I assume that on hotter temperature days, especially during the summer in California, the airflow is reduced, so may be less effective?
It's a great question. And just to make sure we're all on the same page, I think what the question is asking, not about the venting range hoods that we mentioned, but about like opening a window. If you have a venting range hood, that is definitely the best way to do it because that's the way to remove it most directly. The open windows, I think people have experience. So cross breeze works really well. If you can open windows on either side, that's not available in a lot of apartments. But if you're only opening a window on one side of your house or one window, the amount of air exchange you get is very unpredictable and very variable. Whereas with a mechanical ventilation system, it's more consistent. If you only have one wall, like you're on an apartment or something, if you can open windows in two different rooms, or if possible, open, top and bottom parts of windows, all of that helps with circulation. And then of course, mixing air with fans or whatever also helps to kind of improve the performance of your natural ventilation.
Excellent. Thank you, Brett. And our branch chief, Bonnie Holmes-Jen, is, surprise, going to moderate our final Q&A session. And I know she has some questions sort of for the group at large. I think most of our panelists have managed or have been able to stay on, but again, if any more questions come in for either you, Brett, or Stephanie related to this panel, we'll try to address those. But also at this point, we'll just go ahead and turn it over to Bonnie so she can address some of those questions. So go ahead, Bonnie. And you're muted.
Yes,
There you go.
this has been a really exciting workshop. We've heard a lot of important information on progression of studies on indoor air quality and some of the more recent studies from agencies and other experts. We've heard different approaches to developing standards and sifting through and evaluating the health evidence from WHO and the Canadian Health Canada. And all of this is going to be extremely helpful. We've heard important and very valuable input from community groups on community issues and concerns. And we have a better understanding of why lower income communities are experiencing higher levels of pollution indoors and some of the data, including community studies showing these higher exposures and effects from combustion inside homes. And we've had an important review of health studies from experts, a very extensive review of health studies. We'll have to be circling back to Stephanie and Brett and others to sift through this important information. So I guess that's a foundation for the question, which is for any of the panelists, are there specific gaps in information? Obviously, we couldn't cover everything today, although we've done a lot in 4 hours, but are there specific gaps in information that ARB should look into going forward as we move forward in our process of further identifying what options we might consider for our updated standards? I think there's been very strong evidence presented on the need for updating the standards. I'm very appreciative of all of that, but are there gaps in information or other areas of research or just other areas that we should investigate that haven't been discussed today? So I'll just maybe put that out generally and see if anybody from the panel might want to comment on that. I think it could be for anybody. Well, and if maybe we've just had a very exhaustive discussion.
I mean, I think we've certainly touched on a lot of things. I don't know that we've managed to be exhaustive on all of them, right, Bonnie? But but I think we've definitely touched on a lot of issues. I do think that mixtures one that I was mentioning at the end is a really key thing that we're really, doing a better job of understanding from a scientific standpoint and also from a regulatory standpoint, trying to figure out, we as sort of a larger field, trying to figure out how best to address that. And I think it's something that, we as a larger society, larger field, and also you guys at CARB should think about as well, as are there ways to, change what the paradigm has been for how we think about mixtures.
Right. And it probably goes to understanding mixtures of pollutants and just better understanding these combined impact of all the different sources of pollution people are exposed to. I think Brett has his hand up.
Yeah, there's a couple points. They might be finer points, and I don't think any of these points are ones that should like stop, setting a guideline or considering. But one is that what we call nitrogen dioxide effects may be some combined effect of nitrogen dioxide and HONO, which is almost always emitted with it, especially from gas burners. And then also ultrafine particles, right? So I think to the extent that we're looking at effects from indoor sources and gas burners, it's hard to differentiate and tease those out. But again, I don't think it's necessarily problematic to use NO2 almost as an indicator of that mixture. So when you're looking at exposure data or exposure studies, if you've measured NO2, first of all, a lot of the measurements of NO2 actually capture the HONO. So what you're measuring is a combination of the two. But again, to the extent that it's also capturing ultrafine particles or the effects of that, then you can kind of get the two for that one measurement. And then the point, I think I was really appreciative of Stephanie bringing this up, that there's been so much focus on the respiratory effects. And there's, I'm not the physician, but listening to Stephanie and reading the papers, et cetera, seems that there's good reason to expect, like she mentioned the pink eye, right? So like it's an irritant, right? So like it's not, to me, again, maybe it's not that surprising that increases, because it's like it's irritating that mucous membrane, and like, so anyway, there's lots of things these other effects. I think we should take them very seriously and consider them, and hopefully keep driving the better and better health data so we can nail it down.
Okay, great. Thank you so much. That's very helpful. I think we have a hand raised. Is that correct, from LaDonna Williams? And then there's two other questions we have.
Yeah, and I saw that we have a question that looks pretty kind of specific to the panel. This is for Dr. Holm. This is from LaDonna. Are there trainings and workshops with doctors on how to talk with patients? Most pediatricians and general practitioners seem very limited when we raise these issues with them.
Well, LaDonna, it's a pleasure to meet you, and I, wish that I could say that I had planted you to ask this question, because this is so useful for me. We at the Western States PACU actually do a lot of training on pediatric environmental health and all kinds of related issues. That's sort of one of our primary roles. Really working with both providers and the public to help folks understand pediatric environmental health. We do a number of things. I give a lot of lectures. I don't know what group you work with, but feel free to reach out to me. But we also have a bunch of CE courses that are published on our webpage, and actually relevant to this topic, our Story of Health, which is a narrative storytelling based format that weaves scientific information throughout in a multimedia format. We've got 6 chapters all focused on either different conditions and how environmental health affects those, or different exposures and how those affect health. Our chapter on asthma was just revised and reaccredited actually as of last week. It is up there, it is brand new. It's got continuing education credits available for physicians, nurses, health educators. It's through the CDC, basically any kind of continuing education you can think of, it's there. So I would highly encourage folks to direct people to that. I will put the link in the chat. We also have a pediatric environmental health toolkit that has sort of general pediatric environmental health information really aimed at primary care providers. So that should be a useful resource as well. But yeah, I'm full of resources for health providers, so feel free to reach out if there are other things that I can ever do to help.
Awesome. Thank you so much, Stephanie. I think we have a question from Nina Prescott. Nina, did you want to just tell us your question? How indoor air guidelines align with appliance regulation, but I'm not sure which regulation you're referring to.
Hi, yeah, sorry, I wasn't able to unmute. My question was just generally in the first panel, I believe it was Health Canada that mentioned the importance of aligning indoor air quality guidelines with other federal departments, including like consumer product safety. So I was hoping Health Canada or CARB or others could speak to how that works between setting those indoor air quality guidelines and ensuring consumer product safety with appliance regulation.
Do our Health Canada panelists have a response from your experience having your indoor air guidelines? I'm not sure if they're on. I would just,
we're here.
Okay,
sorry.
go ahead.
Just wasn't sure Jocelyn was is here or not, but yeah, so usually, I mean, it's a long process, right? So the guidelines are set first, and then there's a lot of people that get involved in order to make that guideline incorporated into some kind of standards. If people missed the presentation this morning, Jocelyn mentioned a couple of examples. One was for ozone, another for formaldehyde. And yeah, so usually what happens is they take the health-based guideline, and a lot of work goes into converting that into standards. Does that answer the question?
Hi, this is Jocelyn. I wasn't able to mute for a little while there. One of the ways in which we deal with that is also that we have an internal review process where where all of the groups, the implicated groups within Health Canada, are given the opportunity to comment like early before publication, before the public gets to comment, so that we can work with them at that point. The other aspect is that quite frequently, when consumer products is assessing a particular risk, or if they're working on a regulation, they will work with us and try to determine their risk based on the guideline values that we've developed.
And I would just comment briefly from ARB's perspective that that's an important reason why we want to update this guideline, is so that we can have this important health information to inform our policies going forward, and to work with and help inform policies in other agencies. And so we do want this information to be updated and used, and to help in many ways, designing mitigation efforts, other ways in trying to help improve indoor air quality in homes and help people learn how to create cleaner air spaces. I think Zach has his hand raised. I know we're getting close to our 1 o'clock ending time, but Zach?
Yes. Hi, Bonnie. I just wanted to follow up on LaDonna's question about trainings for health professionals and specifically physicians. Not in any direct competition with Dr. Stephanie Holm, but this is my entire job, is to educate health professionals about the human health effects of specifically gas stoves. So I'm about to drop a couple links into the chat. This first is PSR National's entire page about the human health effects of gas stoves, with the links to our CME accredited training right there. And if you're looking to talk to your doctor and ask them to come to a training, we have one next Wednesday, May 24th, in collaboration with, if anyone knows, the Medical Society Consortium for Climate and Health. We are partnering up for a CME accredited webinar next Wednesday, May 24th at 10 a.m. California time, 1 p.m. New York time. So by all means, please spread that far and wide, and let all of your health professional and physicians and nurses know that is going on. Thanks y'all so much.
And
Right,
there's a
and you
lot
put-
of work to do in this area, so it's good for all of us to be involved. No competition.
Right, and you put information, you're putting information in the chat on that, right?
Yes,
Oh, you have
absolutely.
already, okay. And then Brett, I think you might have the last question here or comment.
Oh, thank you. Yes, I'd like to comment. I'm a neurologist working in Oakland and Richmond, and I think I see a lot of the patients that this panel has been referring to as people who are having complicated or compounding effect from being a vulnerable population, socioeconomically, people of color, redlined, who are getting high exposures from external sources, outdoor air pollution, and then many of them live in apartments with low income, may not have adequate maintenance or ventilation, and they are getting higher and nitrogen dioxide exposures. I just wanted to congratulate this excellent panel. I think it was an excellent discussion, and I really appreciate all the insights and information that was shared and thoughtful research. I just wanted to mention that it seems clearly we are focused, or you are focused on establishing guidelines for nitrogen dioxide, and that there's enough evidence here based on both health and justice issues to be focused on more stringent guidelines, at least matching what Canada is outlining, and also there's a huge public health opportunity which perhaps this direct area can't address, but any movements toward improved public health require a coordination of many government agencies and working with communities so that there's a coordinated response to these. And there's a huge public health opportunity to increase ventilation awareness that seems lacking. If only 35% of California homes are using ventilation when they're cooking. And then I did want to also emphasize as a neurologist, what Dr. Holmes was saying, there's a huge effect from outdoor air. For my patients, the refineries in Richmond and the diesel fumes in Oakland are compounding. And then in many places, like in the Central Valley, as was outlined, there's a huge burden of air pollution that way is outside the acceptable standards. So these are compounding for people. And then if we're going to make effective health and justice changes, we need to coordinate with communities and protect them and give adequate funding so that we can move forward on a justice focused health and improvement of our future of climate mitigation. And I appreciate everyone mentioning that and emphasizing that in this discussion. Thank you very much.
Thank you so much, Brett, for your excellent comment. And we appreciate and take that to heart that we do need to coordinate and plan to coordinate with communities. And we need to take into account these compounding factors that communities are experiencing. So thank you for those excellent comments. I think I'll turn it back to Jeff to talk about next steps and close us out at this point.
Great.
Thank you so much.
Yeah, thank you, Bonnie. So yeah, I want to be respectful of everyone's time. We are running just a little bit over, but I just want to say a huge thank you to our panelists who presented today. Wonderful presentations, really informative. We couldn't have done this without you. And also thanks to just my colleagues who helped out today, really helped us to go smoothly. All of our attendees, we appreciate you being here and we appreciate your comments. We're going to post the video and slides in the next couple of weeks, so we will send out a note to the list of attendees. And you can look for that on our IAQ guidelines webpage, which is shown here. And also, if you have any additional comments, anything that you would like to add that didn't get addressed today, please feel free to email us at iaqguidelines@arb.ca.gov, and we will make every effort to get back to you and respond. So again, thank you. I am going to stop sharing, and I'm going to sign off and say thank you again for attending. We will have another workshop it's going to be probably in the spring of next year to kind of bring everybody back up to speed as to where we are, and I talked about that in our introductory presentation. Hopefully we'll see a lot of you then. So thank you again. Have a great day.
Thank
Thanks,
you.
everybody.